I am a person-centered counselor, and I have also received a training in cognitive behavior therapy. I am a master trainer for Thinking Healthy program, and I have delivered trainings across globally in many countries. And recently, for the last 2 years, I have been delivering this training via Zoom. So this is now a new world. But it's good. I think I'm finding it quite effective. The only thing which sometimes I struggle is when doing the role plays. That could be difficult. But since this is a training which has been condensed into 2 days, 5 days training, so I think there is not going to be many role plays. It's going to be more discussions. So first of all, yes, and I have been working in the area of mother and child mental health for the last, I think, 30 years. So I would like all of you to introduce yourself briefly, just take 30 seconds each. Just tell your name, your job title, and what are your expectations from this training. That's very important for me to know. So could we please start from Maria, and then Maria, if you could name the next person who can introduce herself so that we can quickly move on with the introductions. Maria?
Okay, so hi all, Maria here, and I'm the project coordinator at Thunai, specifically for the Thai Nalam Pudunalam project at the RSRM hospital. And my expectations from this training is I kind of, learned all about the THP manual. I read about it from A to Z, so I know everything about it, but I wanted to know how to implement it. We had, like, while even reading it, I had several doubts, how this can be done. Can it be done in a different way? So we as a team, we had several doubts. So I wanted to know how to implement the manual.
Excellent. Good. And I hope that you have noted all those points. So these 2 days we could have discussions around them.
Yes.
So who is going to introduce next?
Shall I tag someone?
Yes, please.
I'm tagging Rashmi.
Yeah, hello everyone. I'm Rashmi Thakkar and I'm with ACOM. I'm working there as an associate director. I look into the M&E proposals and MIS and support with the strategic programming in ACOM. And I would like to learn more about the entire program and how we can strengthen our maternal and child health initiatives in ACOM. I've been in for the past 20 years working in the development sector. Particularly, my heart lies with maternal and child health care. So I look at this training and how we can strengthen the work and we can impact more children and women. So that's what my expectations are from this program.
Thank you very much, Rashmi. Next.
Yeah. Subhashi, you'd like to go next?
Sure. Yeah. So I'm a biomedical engineer by qualification, but for the last 10 years, I've been working into maternal and child health, and I've been designing programs for public health system. So when I was wanting to work on the first 1,000 days, there was always talks about nutrition, but no one talks about the maternal health or the mental health perspective as a whole. So when we were doing some programs and I was designing few around the first 1,000 days, I was thinking it's very important to sensitize and get into the importance of introducing programs that are more into the holistic component, not just nutrition, but also how the mental health component is very important for a better outcome from pregnancy to childbirth, and it has an intergenerational effect on what we are working. So that's the reason we had discussion with Tunai, and my take from this program is understanding how this entire thing works and see how I can tag in whenever I have a strategic discussion and pitch document with funding partners. So that's the angle I'm looking at this, and to learn and to put it into right use.
Thank you very much. Next.
I'll tag Maithili.
Hello, my name is Maithili. I'm actually a physiotherapist by profession and also an alternative medical practitioner. So I play the role of an academy lead and a consultant in ACOM Foundation. So my main objective behind this training program is we also work on sustainable well-being initiatives at the field level. So try to understand and create a system which can be easily transferred to the grassroots level people. So the message spreads. Thank you. I'd
Thank
like
you
to
very
tag Dr. Sri Vidya, ma'am.
Yeah. Hi, everyone. Sorry, I could not switch on my video. I'm outside. Yeah. See, I'm a psychologist. So I'm specialized in mindfulness-based cognitive therapy. And along with that, I do other integrated psychotherapies as well. So with my practice, I've seen many perinatal depressions, how it has caused the disabilities in children. So with this initiative, I'm very happy like the perinatal depression is going to be addressed. And I'm also part to help so many mothers out there tonight. So looking forward to seeing you all. Thank you.
Thank you. Can you tag someone?
Yeah. Subhashri from tonight.
Yeah. Hello, doctor. Hello, everybody.
Hello.
I'm Subhashri. I'm taking care of operations and logistics of tonight. And this project is very, very close to me because I just want to learn because of some few my personal experiences that I had in my lifetime during my delivery. So I just want to understand so few things was not up to what I expected. So I thought this should not happen to somebody else in the society or whomever that I know. So I thought I should understand this comfortably. Then I want to understand what happened to me then. So I don't want somebody else to face the same problem. So I thought I should participate into this to understand what is it all about. So there could be a number of reasons for somebody suffering, but that should never be, maternal mental health. So this is my takeaway. I want to take away this from the training program.
That's excellent. Thank you very much. Can you take someone?
I can take Kalyani.
Yeah, thank you.
Yeah.
So I'm Kalyani. I'm a research fellow in the area of maternal mental health, and I'm specializing in postpartum well-being of mother and infant. So, and I'm in the process of developing a program for a psychoeducational program for mothers in the postpartum phase. Yeah. So I'm interested to learn from this program.
Excellent. That's brilliant. Thank you. Are we all done or is anyone left?
Yeah, I'm there here. My name is Dr. Aparna. I'm sorry I'm unable to switch on my video. I'm driving right now. I'm a dentist by profession. And my basic motto is I would like to help the rape victims and the kids, for gender transition, gender transition stage. So I was once asked by a person that what do you think what experience you think you have to help these people? So I right now take this opportunity to get trained by you, help people who are in need, so that I am mentally trained to help those people.
Excellent. That's brilliant. Thank you very much.
Thank you. I am not able to tag anyone right now because I'm not able to see into my screen.
Okay. Can you name anyone? Is anyone left?
I remember Amuda.
Amuda is right now in the call. So we can, Janet, can you go and tag Helen? Janet? Okay, Helen, can you go next? Steffi is left, I also believe.
Yes,
Steffi, you want to go next?
Myself, I'm
Janet, we are unable to hear you. I hope you have some network issues.
Yes. Can you hear me?
No, Janet, we are unable to hear you. I think it's when you can you can type it in the chat box.
Can you guys hear me? Let's
So sorry, we can't hear it, but let's start. I think Samita is here. Samita is now with us as well, and I think all of us, we know Samita. Am I right?
Yeah.
Samita, are you here?
Yes, ma'am. Yes, Dr. Najiya. Hi. Good morning.
Hi.
Sorry, I'm late.
Excellent. So I'm just going to start with the slides now. And some of those, if you haven't introduced ourselves, you can introduce while we are doing this training. First of all, it's very important if we download the WHO Thinking Healthy Program manual. Maria, has the participants done so, or they can do it now?
Yes,
So
they are done. Almost all are done.
On your Google, and then
Dr. Najiya, what we kind of did is we gave them an introduction with the initial pages of the manual extract for before they came in. They have read through that, and they also have the manual with them, which Maria has already circulated. So they'll be looking at it as you are this thing.
That's perfect. Thank you very much.
You could also state it explicitly now. Since the group is here, please.
So it's very important if we have on our screens our Thinking Healthy Program manual as well. So if we want to access it, we can access it. So here are some ground rules for this workshop / training. Please, this training is going to start at 7:30. I don't know what time it's going to be in where you are, Maria. Is it?
It's 1:20 right now. 1:20 p.m.
So, what time this training is supposed to be starting?
1
o'clock. 1 o'clock.
1 o'clock. So, please make sure that everybody is there at 1 o'clock so that we can start on time. Another thing which is very important is if it is possible, please keep your cameras on, or at least when you are talking, have your cameras on unless there is some problem. The third very important point is to ask questions. And please remember that there is no question which is wrong. Questions are always right. Answers could be right or wrong. So please don't stop yourself if you have any question. Don't think that, whether this is a relevant question, I should not be asking it. Please ask as many questions as possible. So there is a raise hand feature in Zoom as well, which I think most of you are aware of. So please, if you can just raise your hand if you want to say something. And Maria, when I'm displaying my screen, sometimes I can't see the raise hand. So I will really appreciate if you could just say that this person has raised their hand and they want to say, and interrupt me, please. For the mobile phones, it will be really appreciated if your mobile phones are on silent and you try to keep your mobile phone slightly away from your reach so that you don't check your messages while you are receiving this training. Another very important rule is that I would like you to be enjoying this workshop as well. So please, and we enjoy when we participate. So please participate as much as you want. Bring your personal experience in this workshop so that we get most out of it. Do you want to add any ground rule for participation?
Dr. Najiya, this is your training. We are your students for the next 2 days. Whatever you say, we are ready to absorb it.
You guys are so experienced. I'll rather call you my colleagues. And the best thing is that all of you, when you were introducing yourself, I could feel the passion in you to work for your communities and to improve the maternal health and the children health. So that is the most key thing when receiving this training. So actually this is the 5-day training and we are going to condense it into 2 days. So in order to do that, I will be needing a lot of help from you. So I will be quickly passing through one topic to another topic. But if you feel that you need to know more and understand more about that topic, simply stop me and say, can we discuss it more? So that is what will be very, very important. So I will start with introducing to you what Thinking Healthy program is. Thinking Healthy program is an evidence-based psychosocial intervention. By psychosocial intervention, we mean the intervention which focuses on the emotional aspect as well as the social aspect of someone's well-being. So when we want that person to have improved emotional well-being and improved social well-being, we deliver psychosocial interventions. And by the term evidence-based, it means that it has been tested and it has been proved effective for reducing the pre- and postnatal depression in mothers. So Thinking Healthy program is an evidence-based psychosocial intervention for mothers who are experiencing pre- and postnatal depression. And this is the intervention which is not delivered by mental health specialists. This is the intervention which is delivered by, if you have community workers in your communities, if you have volunteers, if you have, sometimes we have this lay counselors. So these people, they don't have to be the mental health specialists to be delivering this intervention. So this is one of the very, very basic key feature of this intervention. And why do we want interventions to be delivered by non-specialists? The reason is that the prevalence of pre- and postnatal depression is very high. So globally, 1 woman out of 10, she experienced pre- and postnatal depression. Whereas in low and middle income countries, the prevalence is much higher. So 1 woman out of 4 experienced pre- and postnatal depression. So very high prevalence. The prevalence is very high, but the mental health specialists in low and middle income countries are very few. So if you look at this diagram of psychologists, you see in the high income country, there are 14 psychologists for the population of 100,000. Whereas in the low middle income countries, only 0.60 psychologists for the population of 100,000. And if you look at the psychiatrists, psychiatric nurses, in the high income countries, there are 32.95 psychiatric nurses for the population of 100,000. Whereas in the low and middle income countries, there is only 1 psychiatric nurse for the population of 100,000. So because of this huge gap between the people who needed the treatment and the people who provided the treatment, is almost 90 to 100% in the low and middle income countries. So when this gap is so big, the people who wanted some mental health treatment and the people who could deliver it, there are very, very few. So say that for the population of 100,000 women, if there is only 1 psychiatrist or 2 psychiatrists, it's not possible for them to help this much people who are in need. So there is this strategy of task shifting, where mental health specialists, they train non-specialists who then reach out to the people who need the help. So when we delivered this trial in India and in Pakistan, I trained 5 lay volunteers. Those 5 lay volunteers in turn, I trained 5 trainers. Those 5 trainers in turn trained 40 lay volunteers. And those 40 lay volunteers reach out to 400 women. So the training is cascaded down from the mental health specialists to the trainers and then to the non-specialists who then reach out to these women. So it's the same method which we are following here. I am training Thinking Healthy program trainers, hopefully, and then you will train the community health workers, the lay volunteers, the lay counselors who will then reach out and train the mothers. And this technique has been found very effective because it helps to alleviate the workforce shortage. this shortage, this treatment gap, which is 90 to 100%. Even in high income countries, it's 50 to 75%. So they are also trying to rely a lot on the strategy of task shifting or task sharing. Is that clear to everyone? Excellent. So
Yes,
originally,
yes.
Thinking Healthy program was developed and tested in rural Pakistan. And I have worked in India, and I know that the similarities between these two countries are huge. They share lots and lots of similarities culturally. And if you put aside religion, the people, their core is very similar to each other. I know the politics have spoiled everything, but it's all that bad things which are happening. Just put them aside, and you will see, even in this, when we will be discussing the training, that how similar it is. Even by looking at this picture, you can tell that how similar these pictures are to the people in Pakistan, India, isn't it? So this was developed and tested in Pakistan on 903 participants in the trial, and 463 participants, they received this intervention. And this intervention was delivered by community health workers, which are called lady health workers. So in Pakistan, we have lady health workers, which have been working for the last, I think, 30 years. Lady health worker program, they reach out to the mothers who are pregnant and who have young babies, and they work on mother and child health agendas. They are also working on polio, dengue, and other pandemics. So they are very much well embedded in their communities. So my first question to you is, do you have someone who is similar to community health workers, lady health workers in your areas where you are working?
We have ASHA workers, and Anganwadi workers in India, very similar to the lady health worker group.
Oh.
And we also have SHGs, which are self-help group women who do micro enterprise. They also sometimes participate in a lot of these community health activities and become health spokesperson, in building community, activities. So majorly Ashas, Anganwadi workers, and self-help group women. I think if there's anything else the team can add, but these are the key people.
So it is so good to know that there are people who can be trained on it and who can reach out to the mothers and deliver this intervention to them. This is excellent. Yes. So after this trial was conducted, it was found that there is a reduction of symptoms of pre and postnatal depression in the mothers. There is less disability. Their overall social functioning improved. Their rates of exclusive breastfeeding improved. There is more play-related activities with the infant. Infants are less likely to have diarrhea episodes, and infants are more likely to complete their scheduled vaccination, immunization. So these are the key findings which we found after the trial. So what happened is that, and the trial paper got published in Lancet, and the World Health Organization, they adopted this program as the first line management of depression for primary and secondary care setting during pregnancy and breastfeeding. So this program is now under World Health Organization, and they do recommend it. And so far, the training has been delivered to the list of the countries which is shown here in Bangladesh, China, India. We also conducted one trial in Liberia, Malawi, Nepal, of course, Pakistan, Peru, Saudi Arabia, Sri Lanka. So it has reached out to different countries. And the last training which I delivered, believe it or not, it was in USA. Because they were thinking that they are almost experiencing the similar sort of issues which people in lower and middle income countries are experiencing. They have few mental health specialists. There are lots of women who need help. So they are thinking of implementing it in their socioeconomically deprived areas.
Which part of India was the training done? Which state did this program?
Oh, yes, that's a very good question. Which part was it? I think it was Goa. Yes, Goa. And there are papers which are published on it. If you want, I can share those papers with you. Professor Vikram Patel was the principal investigator.
Sure, that will help us to understand what kind of team they've used to implement it on ground.
Yes, and they called their the community workers. They called them Sathi or Saki. No, what's the word for those?
Sakhi.
Sakhi, yes, they called them Sakhi. Yes.
Yeah, their project was Sakhi. In fact, Dr. Najiya, after you told us about this, I tried reaching out to them, but I haven't got a response. So that would be lovely if you could kind of just give us a nudge there, just a push for us to understand their own, whatever the toolkit that they're using. We spoke at length about it.
It's very important. I am really upset because if they would have been in touch with you, because they have developed the manual, and the manual has all the pictures of which is women in India could relate more. So I don't know. I can also try to get in touch with them. And if I manage, then I can link them with you so that you can get that manual.
Right. We have. I've sent a personal email to the ID that is there on the internet to Dr. Vikram Patel and also to Sakhi's contact us number. Tried reaching out to them via phone, but I think probably it's the pandemic. But I have not been able to get through with them. Any nudge from you will always be helpful for us.
Okay, I will try my best. Yes. So then you don't have to reinvent the illustrations and everything.
So when was the training
the most important thing is that the Thinking Healthy program. Sorry, somebody was saying something?
Yeah. Me just wanted to check, when was this training done in India? A few years back?
That was in 2012 when we did that trial. Okay. And the trial lasted for 3 years. So it was around 215 when we found the results.
Okay.
So the Thinking Healthy program, it moves away from the medical care model. So what happens is that most of our people, they are used to of taking the medications for everything. And that is, they feel is a much more simpler solution. But here, when we deliver psychosocial intervention, we move away from the medical care model, and the depression is treated by through talking intervention. And sometimes this can come as a barrier because people are not aware of what talking therapies are and how could somebody get cured just through talking to them. It focuses on mother and infant well-being rather than maternal depression. Now, this is a very, very important point. So when we say that this is the intervention for mother and infant well-being, it is very important. We don't say that this is the intervention for mothers who are depressed, because what will happen is that there is such a huge stigma of depression in our communities that people will say that, no, I don't have a depression. I don't want to receive it. But when you say that this is the intervention for your and for your baby's well-being, people are more open to receive it and their family members. So when we trained our community lady health workers, we told them that when you go, tell the family that you have brought this intervention, which is for mother and baby's well-being. Don't use the word depression, because then most probably the families will say that, sorry, our daughter-in-law doesn't have a depression. Please make yourself go out of this house. We don't need your help. So this is very important. When you will be training them, tell them not to use the word depression, just say that intervention for mother and baby's well-being. Again, this is a community-based intervention, which means that the intervention reaches out to mothers at their home. The mothers are not coming to receive it. Again, this is something which you guys can decide depending on your setting. But here, the community health workers, they are very much well embedded in their communities. They are used to of going to mother's house. Mothers are used to of mothers and their families. They are more accepting towards them. So they allow them to come in the house and the intervention is delivered at their homes. Another reason why this intervention is delivered at their home is because it encourages the participation of the family members as well. So whenever the lady health worker, she goes to deliver this intervention, she invites the mother-in-law, husband, any adult family member who wants to come and sit in the session. It has two advantages. First, it reduces the stigma of depression which is there. Secondly, it ensures that mother gets the support of the family. Majority of the families which we work with, they are living in joint families. So the father-in-law, mother-in-law, and it is similar situation in most probably where you are going to deliver this intervention as well. So it's very important to involve them so that they know exactly what is going on and they provide support to the mother. Because sometimes in our cultures, mother-in-laws can become suspicious as well that what's happening there. What is this woman talking to my daughter-in-law? I hope she's not talking about contraception or empowering her so that she can start fighting with us. So it's best if the mother-in-law is also sitting with during the session. The way these sessions have been developed is to integrate into the existing maternal and child healthcare programs. So if there are any maternal and child healthcare programs running in your settings, and if you have community workers who are running these programs, they can also deliver these sessions during their routine visit to the mothers. They don't have.
Dr. Najiya?
Yes.
I have a small question. Since you mentioned that it would be effective to also have mother-in-laws, I just have a small opinion, or rather a doubt, I would say, because women tend to like shut down when they have their in-laws with them. They don't come up with what is going on with them emotionally. So wouldn't it be better to like like skip the mother-in-law part and do it separately for them, and probably have a session where all the family members can be included, so that the women can come up with whatever's there within them?
Excellent. This is a beautiful question. And so these are the things which you will be deciding when you will be adapting it according to your setting.
Okay.
So for example, we are now delivering this intervention which is called Happy Mother Healthy Babies, in which we invite the families only on the introduction session and the session which is focusing on mother's relationship with people around her. So from our experience, inviting the family members in the introduction session is very important. And afterwards, it depends upon what the mother wants and what the community health worker feels is the best for the mother. So it is not set in stones. It can also vary from family to family, from one situation to another situation. The mother-in-law becomes so much domineering that it's become difficult for the mother to say anything during the session. In that case, maybe it's important to give mother an opportunity by delivering one-to-one session. In some sessions, you could feel a mother or a husband has benefited a lot from the session. So it's good to invite them. So a lot of this also depends upon the situation. So this intervention actually encourages the family members to participate, but then the decision lies with whatever is best for the mother, because at the end of the day, we want our mothers to improve.
Yes, thank you.
Is that clear?
Yes, doctor.
Excellent. Okay, so this intervention, it focuses on 3 areas of mother's well-being: mother's personal health, mother's relationship with her baby, and mother's relationship with people around her. So it has sessions. So it has 5 modules. Module 1 is delivered during the pregnancy. Module 2 is delivered after the baby's arrival. Then module 3 is early infancy. Module 4 is middle infancy. Module 5 is late infancy. Each module has 3 sessions. One session focusing on mother's personal health. one session focusing on mother's relationship with the baby, and one session focuses on mother's relationship with people around her. So 3 sessions in each module. And in total, there are 16 sessions. Again, you guys will be deciding, because sometimes these 16 sessions, starting from when the mother is pregnant until the baby is 10 months old, it seems very a big engagement with the mother, a time commitment. So sometimes we have to decide what's best can be done, and we will be talking about it. But originally there are 16 sessions. Session 1 is during the pregnancy, and then the last session is when the baby is 10 months old. Any question? So just remember these 3 areas. What are the 3 areas?
Mother and self.
Personal health.
Personal health.
Mother and the baby.
Mother
and the
and the baby
relationship with
and the
others.
society.
Yes, these
Yes.
3 areas. Excellent. So there is the reference manual, which hopefully you have already downloaded from the WHO website. At the end of the reference manual, there is a health calendar. So the reference manual gives step-by-step instructions to the health worker on how to conduct each session. The health calendar, you print the health calendar and then you give it to the mother. That health calendar helps the community worker to deliver the session as well. It has got all the illustrations and it has got the health charts. With the help of the health charts, you will be setting the homework with the mothers. It's important if you print these health calendars and give it to the mothers in the introductory session, which is session 0. And currently we have this job aid, which we find very helpful for the peer volunteers when they deliver the Thinking Healthy program. It is in Urdu, but we are translating it into English. Once that is done, I am happy to share that with you as well. So that is simple, 1 step, 2 step, 3 step, 4 step, and that helps the lay workers to deliver this intervention. So hopefully I will share it with you in the next couple of weeks. So there is at least a need for the 5
Dr. Najiya,
days.
Sorry for the interruption. So the health calendar do consist of the mood chart, the diet chart, and the activity chart. Am I right?
Yes. Okay. Yes.
And these three.
No, it has more charts as well. It has baby bonding chart.
It will just get disintegrated to each different categories, right? Yes. On the personal and the health chart.
Yes.
Am I right?
Yes. Let me just give me 1 second. I'll grab my copy of the reference manual. Just give me 1 minute.
Sure. Smita, you too have some similar queries regarding the health calendar, right?
Yes, I do. I was just wanting to tell the team that if they are looking at the TH manual now, you have to just go to the last part and you will find the full takeaway. But let's see how ma'am answers the query that Maria has.
Sorry, I couldn't find it. It must be upstairs. So another thing which you can do is, Maria, Samita, if you download the Urdu version of the Thinking Healthy program, you will see the illustrations, and then you guys need to think and decide whether you want to use the illustrations which are in the WHO English version or the Urdu version.
Okay.
So there is this, at the end is the health calendar, which is all the charts. Sorry?
Problem being, we wouldn't understand the Urdu version to read it.
But even,
so we wouldn't
even if you don't understand the Urdu version,
the pictures will be explained.
You can just use those illustrations.
That's correct. Okay.
But it depends on you guys whether you feel that women could relate to the pictures which is in the English version, or they could relate more to the pictures which is in Urdu version. The thing is that there is an Indian version as well, but you guys, I don't know how you'll be able to get it, but I'll also try my best so that you can use that illustrations which people could relate the most.
Maria, can I talk?
Yes, please.
Yeah, like I wanted to share something to Maria. Maria, for each session, no, there are 3 charts. Even I didn't go through the entire, manual, but for early infancy, there are 3 charts, and for the late infancy, for everything, for each and every session, there are 3 charts, I guess.
Yes. So for every session, at the end of every session, there must be a chart in which you decide what activities they want to do. I just want to show you the Urdu version.
And according to the session, the chart is also varies. For example, if we take early infancy, there is a chart called exercise chart, sleep monitoring chart. So it differs actually. So I think we have to learn a lot. Now have to read a lot.
It's a
very huge.
So this is the Urdu version. So
Dr. Najiya, we can't see the Urdu version. We're still seeing the PowerPoint.
Is it? Why?
Yeah.
You have to stop your screen
and share again. Okay. Can you see it now?
Yes.
Yeah.
So these are all the, sorry, let me go to that part where there is this reference manual. Sorry, a health calendar. So actually these are the original photographs, and when you see the World Health Organization, they have also adapted these pictures. So many of those pictures you can tell that this is how it has been adapted. So this is the health calendar, and these are the mood charts which we will be discussing again. These are the charts which they have to fill every day. These are the illustrations. So that is how it looks like.
Dr. Najiya, I have a question at this point. May I raise a question here? So, am I audible?
Yes, I can hear you. Yes.
Yeah. So you the mood chart that we are you have shown us here, and the whole takeaway kit, right? So this is I'm trying to understand. So this can be used by even a peer counselor or somebody who is not from a mental health background once they're trained how to use this as a toolkit, right? Because it will be very simplified, and it will be that they'll just have to direct them that, you have to tick this, tick that. That's it, right? That's one. Okay, so that's right.
Yes, excellent.
And
that is the whole idea, that it has been simplified so much that anyone who has got at least 10 years of schooling, they can become the delivery agent for the Thinking Healthy program. And there are lots of illustrations because the mothers who will be receiving this intervention, maybe some of them, they could not read or write. So they get the message just by looking at the illustrations. So what is the literacy rate of women in your areas? Are the women literate?
It varies state to state, within India. But I don't know the exact percentage. It kind of varies state to state. But When you go to the rural part, which are the key beneficiaries for us, because people from public, people who maximum use the government system are from backward, BPL community. So, no, I would say like, I can't put a percentage.
So we will be discussing that as well during this training, that how important it is for us to know the area in which we are delivering this intervention. Because if we will understanding the needs of the people, then we will adapt it accordingly. Because you need to be doing some adaptations when you will be delivering it in your settings. So when you will be training them, then at least 5 days of classroom training will be needed. It's good to have small groups because you needed to have them the opportunity of practicing it through role plays. And usually the training is delivered by the pair of trainers, and the training is consisted of brief lectures, group discussions, and role plays. Following the classroom training, it is important for them to have the field training as well. So personally, this is something which I will advise you guys as well, that after you will receive this training, it will be really, really helpful for you if you could actually deliver it to a depressed mother. So if in your area, if you manage to find a mother, you can administer PHQ-9, which we will discuss later. And if you think that this mother is depressed, if the score tells that yes, this mother is depressed, please deliver this intervention to her, because then you will have the first-hand experience. And that first-hand experience helps to become a good trainer. You cannot become a good trainer without actually delivering this intervention yourself. So this is highly, highly, highly recommended. Supervisions are very important whenever, Samita has her hand raised. Yes, Samita?
Dr. Najiya, when you mentioned about the training, when you mentioned about using the THM, at one point you said all mothers have to go through the MOOC charts, the health calendar, right? Now, when we are training, now that we are training together, we do this for all mothers in general, or only for mothers who score in the PHQ or who show signs of depression?
Okay. So, Samita, we have to park this question because we will be discussing about this implementation and which tool to use to identify. So, just you will find this answer as we move on.
All right. Thank you.
So supervisions are also very important. Whenever there is a task shifting or task sharing, supervisions become key thing. So if you guys will be delivering the training to community workers, I don't know exactly what you intend to do now. Maybe you want to deliver this intervention, or you want to be training other people to be delivering this intervention, but supervisions are very important. So if you decide to deliver this intervention, I am happy to give you some supervision sessions where you can discuss the problems which you are experiencing. Then it is also very important to adapt it according to your context and according to your systems. So people have done that. For example, in Malawi, they only delivered it when the women are pregnant, because they don't have that much resources where they can deliver the whole 16 sessions. So they focus only on women who are depressed during their pregnancy, and they deliver them 4 sessions. The trial which we are conducting now, we deliver module 1 and module 2. So when the mother is pregnant and after the baby is born, and until the baby is 3 months old. So you have to be thinking on what is best for in your setting. How many sessions can be given to the mothers? And it is very important that you make those changes if you think that women cannot relate to the illustrations, maybe you need to change the illustrations. If there are certain concepts, certain thoughts, certain examples in the manual which you feel is not appropriate according to your setting, you need to change it. There is a Bernal framework. I will be emailing you the list of the things which is mentioned there. And even now, when we are doing the training, it is very important that you start making the list of the things which you feel needs to be adapted according to your setting. So I hope everybody has got their pen and some paper with them, and you keep on making these notes. So is there any language which needs to be changed? Are there any words? What is the word which people use for depression in India? You need to be using that word. You need to be understanding if there are any idioms, sayings, symbols which needs to be changed, any concepts which needs to be changed. Because many women who are experiencing depression in Pakistan, especially in lower and in lower socioeconomic settings, sometimes they complain of headache, and they have this cloth which is tied here. They complain of the body symptoms. So that is how they express their emotional distress, through talking about their bodily symptoms. So how do people they express depression in India? What words do they use? So this is very, very important. What is the context? Are people educated there? People not educated there? Are people living in their joint families, nuclear families? What are the customs? What are the traditions? Because there is one of the custom is that after the baby is born, the mother, she goes and lives with her parents for the first 40 days. Is it the same custom in India? If not, then what are the customs? Because we need to be understanding them. We want to make this intervention very, very relevant to the needs of the mothers whom we are targeting. And that is only possible when we totally understand them. And who is going to deliver it? That is also very important. And which are the organizations who are going to support it? Are these the government organizations or voluntary organizations, third sector organizations? And what are the systems at the policy level, ministry level? Have they got some funding to give to those projects? So you need to have a very, very good knowledge about it. But at this stage, it is very important that when you are receiving this training, you start making a note of all those things which you feel might not be relevant to your target population, which might needs to be changed. Okay. So when we are adapting it, we make sure that we don't completely change the intervention. It has to be the Thinking Healthy program. The basic principle needs to be the same. So now we will, before I start this new topic, any question, any thoughts in your mind which you want to share? No.
Dr. Najiya,
yes?
sorry, I would like to add to the team, so to the facilitators. So, Smita, I've sent you a document in the WhatsApp, right? So, that is a whole document of the Thinking Healthy manual, and Dr. Najiya is breaking down in each topic into each slides. So, you can go through all the slides and kind of observe all what Dr. Najiya is saying, and later on you can please go through the documents. You make a note of it if you have any queries. Tomorrow also we have the same session, and those queries can be addressed in that session. So for those who feels like if you're not able to understand, please make a note of it. Thank you, doctor.
Excellent. Thank you, Maria. So good. And is the pace all right? Excellent.
Yes. Excellent.
So now I will briefly talk about depression and perinatal depression. We all know that depression is a medical condition, and this is a problem which affects how we feel, how we think, and how we act. And perinatal depression is a depression which begins during pregnancy and extends into the postnatal period. Now they have started to use one term for it, which is perinatal depression, because they have found that the majority of the depression, which is we call postnatal depression, it has its origin in the prenatal period. So it is the continuation of the same depression which starts during pregnancy and continue after the baby is born. And therefore, the term perinatal depression is now used for both prenatal depression and for postnatal depression. And therefore, it is very important if we start the intervention when the mother is pregnant, so that if she is experiencing this depression, she starts feeling better and it does not continue after the baby is born. So the perinatal depression can vary in severity. Maternity blues, almost 80 to 90% of the women, they experience maternity blues. So it's very, very common. And it stays just for a couple of weeks, in which you feel very low in mood, you cry, you don't understand what exactly is going on with you, but it just stays for a couple of weeks and then it simply fades away without any help. But even for those couple of weeks, the support is very important from the family members. So 80% of the women, they experience maternity blues. I was one of them. After my son was born, I also was feeling sad and I couldn't understand that what's happening with me. I used to cry whenever I am alone. And I keep on thinking, why am I upset? Everything is all right. I have been blessed with a healthy baby. I have got support around me. But despite that, I used to feel very, very low. So that was maternity blue that stayed for, I think, maybe a week or 10 days and then it passed away. At the extreme other end is the postpartum psychosis, which is very severe, but it is rare. So only 1 to 2% of the women, they experience postpartum psychosis, but they definitely need help. And in most cases, they need to be hospitalized as well, because their own life can be at risk, the life of the baby can be at risk. But thankfully, only 1 to 2% of the women, they experience postpartum psychosis as compared to 80% of the women who experience maternity blue. So in between maternity blue and postpartum psychosis is perinatal depression. And in its severity, it lies between maternity blues and postpartum psychosis. And in lower and middle income countries, around 25% of the women, they experience perinatal depression. So our focus is more on the perinatal depression. So some of the symptoms which women experience when they are having a perinatal depression is feeling of sadness, low mood, loss of interest in things they used to enjoy doing. They experience lack of energy. They feel tired. They have trouble sleeping at night. They have problem concentrating and making decisions. They either have loss of appetite or they start eating more. They feel agitated, irritable. They have feeling of guilt, hopelessness, self-blame. They find it very difficult to bond with the baby. They have frightening thoughts of hurting your baby, but they very rarely act upon it. And they could also have suicidal thoughts. So these are some of the symptoms which women experience when they are going through perinatal depression. So I have told the prevalence of perinatal depression, it's around 11.9% globally. High income countries, it can range between 4% to 13%. And in low and middle income countries, it is 15 to 20%. This is the map here. Where is India in this map? Oh, here. So, according to this map, there is 20 to 30% of the women who experience depression in India. But there must be more latest studies as well. I didn't get the time to go look at the prevalence of perinatal depression in India recently, but according to this map, it is around 25%. So 24.4% it says here in India. Okay. So I would now like you guys to tell me, because according to this map, 25% of the women who experience perinatal depression who are living in India, which is quite high, which means that 1 woman out of 4 women is experiencing perinatal depression. So what are the risk factors? What could be the risk factors? Yes, so let's try this technique. So if everybody could write on the message what they think could be the risk factors, and then we will read through it. So what are the factors which is making women vulnerable to have perinatal depression? Lack of awareness, Subarsi said. Haritha said previous history of mental illness. Maria said intrusive thoughts. And Dr. Siri said dysfunctional family. Mithali said lack of familiar support. Trauma, cultural and peer support. So lack of cultural and peer support, family and societal pressure, marital disharmony. Excellent. You guys have given almost all of the list. Can you think of any other factors? Want for a male child, that's very important. Unplanned pregnancy, excellent. Fertility issues. So if it's a precious pregnancy, then you can start worrying about it. Yes. Gender disappointment. Yes. Excellent. Very, very beautiful list. Loss, bereavement. Yes. Loss, grief. Unwanted pregnancy. So unplanned pregnancy or unwanted pregnancy, both of them, they are the risk factors. Thank you. Not ready what the future holds and how to handle economic issues. Poverty is a very, very big factor. Oh, love you guys. Excellent. Early pregnancy. Many children. Yes. Poor education system. Thank you so much. Thanks. I'm very, very happy. And it just reflects that you have got a very, very good understanding of the risk factors. I will share my list, and I'm glad to say that you have covered almost all the points which are there in my list. Lack of social support, financial difficulties, lack of empowerment is a big one. Women in our culture, they experience lack of empowerment. Lack of education, you mentioned. Lack of appropriate healthcare services. That you guys did not mention. That is also very important. Then fear of childbirth is another very important one. Gender preference, you mentioned. Rapidly changing traditional family structures and practices. That is another contributing factor. Poor marital relationship. One thing which you guys have not mentioned, which is very important, is the domestic abuse. So you guys missed that one. Domestic abuse.
Dr. Najiya, I put everything together under the term trauma.
Yes. Sorry. Excellent. Then poor interpersonal relationship with the in-laws. And here, a husband's extramarital affairs can also be a risk factor. Unplanned, unwanted pregnancy, you said. Husbands who are not working, they can be a risk factors because it is again linked to the poverty. Bereavement, you guys mentioned. Separation and divorce, you did not mention. So that is another risk factor. Political crisis can be a risk factor. traumas. Now I think we need to add pandemics in this as well after the COVID pandemic, because that increased the risk of, actually I will add it now. Then previous history of depression, somebody said that, complication with previous pregnancy, illness, health complications, number of pregnancies you already had, and then number of times you have given birth. So these are all the risk factors. And why it is important to know these risk factors?
To intervene and identify, for us to understand whether the women is at a higher risk of having a perinatal depression.
Excellent. And because if we know the risk factors, when we are delivering this intervention, we are making sure that we are addressing these risk factors as well. So we are at least talking about these risk factors. We are acknowledging the risk factors which are in the mother's life. So it's very important. So another thing is that if a mother who has perinatal depression, what is the impact on mother's relationship with the baby, on mother's relationship with people around her? The mothers who have perinatal depression, they sort of neglect themselves. They are constantly experience unhelpful emotions like worried, tense, nervous, anger. They have self-doubt about themselves. They are lacking in motivation. They experience bodily symptoms. They experience anxiety. The depression can continue if it is not treated even after the postnatal period. And sometimes, the women, they have higher prevalence of depression as compared to men, because many times the depression which started during their pregnancy continue during the postnatal period, can continue even beyond that. So the origin of their depression could be at the time when they were pregnant. And it impacts the mother baby. It has an impact on the baby as well. So during the pregnancy, it's a poor maternal fetal quality of attachment. It results in poor birth outcomes, low birth weight, preterm birth, even miscarriage if a mother is depressed. And after the baby is born, the mother, because she's depressed, she is not have much energy, she's lacking in motivation, she struggles to provide adequate child health care. The result could be child could be undernourished. She was not able to breastfeed the baby. There could be increased diarrhea rates. And it has an impact on the developmental, behavior, and cognitive development of the baby. So it has a huge impact. It's not something that, mother has experienced pre and postnatal depression and then it's all right after the mother has passed that period. The impact on the baby can last for many years, even into their adult lives. Therefore, it is very important to address this problem as soon as possible when the mother is pregnant. It also impacts the mother's relationship with people around her. It can have interpersonal problems. She can lose her social support. She can become distant from her families. So it is a very important issue which needs to be addressed. And as I have told you before, that when somebody is depressed, it can affect how the way they feel, how they think, and how they act. So these are just again some of the feelings mentioned here, which mother goes through when she is depressed, upset, tearful, irritable, angry, guilty, tired, lots of shame associated with it as well. And then they could have unhealthy thoughts like life is not worth living. Nothing is going to change. It's too difficult. I can't cope. Nobody likes me and nobody cares about me. I'm not a good mother. I'm a failure. I can't do anything to change my situation. It's my fault that my baby is unwell. I can't do anything right. Being ill is in my fate. So just imagine a mother who is experiencing these thoughts again and again and again. So we might also sometimes experience unhealthy thoughts, but usually we manage to overcome them. But when somebody is depressed, they can't overcome them. It keeps on coming in their mind. So when you are experiencing these thoughts, of course, it's going to make you feel sad and upset. And then when you are sad, when you are depressed, it impacts your behavior as well. You ignore your hygiene, diet, rest. If you are thinking that nobody loves you, nobody cares you, then you start avoiding meeting people. You stop engaging in pleasurable activities because you are lacking in motivation. You don't have energy. You don't have motivation to do anything. You can't fulfill your day-to-day responsibilities. And that can make you feel guilty. If you feel that you are not fulfilling your responsibilities as a wife, as a daughter-in-law, then you start feeling guilty as well. You can't pay attention to your own children. And then sometimes you become angry and then you have arguments with people around you. That is another big sign of depression as well. If somebody is getting angry and fighting and arguing with others. Sometimes people don't understand that this behavior is also linked to depression. So you have seen how our thoughts are linked to our feelings and then how we behave. So these things are all linked to each other. So for example, if there is a mother who is thinking that I am a failure, then she feels very sad, very anxious. She will feel guilty. And when you are feeling sad, anxious, guilty, what happens? You don't get up, you don't dress up, you don't go out and meet people. You start not looking after yourself because you're feeling so guilty, so sad. You don't have any motivation. So it is very important to understand how our thoughts are linked to our feelings and then to our behavior. Is this a link everybody has understood? Is there any question? Okay. So I would now like you to recall a situation when you were feeling sad. Just think of the last 1 month. Was there any time when you were feeling sad? What was going through your mind at that time? And what did you do?
You feel that there's no solution to the problem. You feel stuck at that point.
Yes. So can you be more specific? Would you mind sharing that with the group? What was you thinking at that time? Sorry, somebody was talking. Yes, please.
It was me, Dr. Najiya, Harita.
Harita, yes. Harita, would you like to share what was happening, what was going through your mind, how you were feeling?
So there was a loss. I mean, we had back-to-back loss in our family. So I felt like very lost. All of a sudden, we didn't have our elders who were our moral support. So I felt a huge burden on my shoulder, thinking that now I'm the one who's heading the family, I have to be more responsible. And that sudden shift of power actually perplexed me. I didn't know what to do at that point. So that was the issue.
Okay. And what was your behavior, Harita? What did you do?
I kind of like froze. I mean, I was not in the present. I was always like thinking about something which was either from the past or I was thinking about the future. So my mind was always occupied with the thoughts. I was not in the present. I was not able to give my attention to the family. And this overthinking led to a lot of draining, energy draining. So by the end of the day, I would just like feel that I have to like just get to my bed and not do anything, not talk to people. And if people try to communicate, I would like snap at them. So that was happening. I was lashing out my anger.
Okay. Harita, thank you so much for sharing this experience with us. So I will now explain the vicious cycle by using the example which Harita has shared. So the situation was that she experienced some bereavement in her family. What she was thinking is that what's going to happen now? It's not good that she has lots of responsibilities on her shoulder. How she's going to cope with it? What's going to happen now? And how she was feeling? She was feeling very worried. She was anxious. She was feeling very overburdened. And what she did at that time, she withdrew herself from others. She did not want to meet people, and that cycle then becomes vicious, because then if you are not meeting other people, if you are keeping yourself to yourself, if you're not sharing your problems with others, you become even more sad. When you become even more sad, then those thoughts which are coming in your mind, they become more powerful. So thank you very much, Rita, and I'm sure that then you were able to break this vicious cycle and you managed to came out of it. So thank you.
Yes, doctor. Thank you.
Anybody else want to share their example if they feel comfortable, or if anything? Yes, please.
Yeah, I'm here. I'm
Sure,
Steffi.
sure.
Like already I have shared few things with my friends, fellow friends, but this thing which I never shared to anyone. When I was pregnant, no, I had this COVID problem. I was tested with COVID positive when I was 5 months pregnant, and it was something new to me. I have never faced in my life, so I was totally anxious, worried. For everything I started to fight with my parents, with my husband. I felt like my husband was not so supportive, because when I got the result, it showed that I'm severely affected with COVID. And that was my pregnancy was the first pregnancy when I was pregnant. So I wanted my baby to be very healthy, but I was very worried, and I was in a total depression, whether my child will be affected or what will happen to my child. And my in-laws and my family members, they put me in a government hospital at that time, because we didn't know where to go. And the community forced me to get admitted in government hospital, RSRM hospital. I was, it became very, very crucial that I didn't like that hospital at all. That was a government hospital. The setup was not good for me. That place was not comfortable for me.
So what was going through your mind? What were you thinking at that
totally
time when you were in that hospital?
I actually I escaped from the situation, I didn't want to stay there. So, I raised my voice. I started fighting.
Before you escaped from there, what were you thinking?
I thought I will lose my child. Something will happen to my child, and the environment was not, comfortable for me. And, that was not a hygienic place. So I felt like definitely if I'm, still staying in this hospital, I will lose my child. Something will happen to my child, to my health. A lot of things were going on in my mind. And
so when you were thinking that you might lose your child and this is not a hygienic place, how was that making you feel? What were you feeling at that time?
I didn't.
When you were thinking that I will lose my child, this is not a right place, how were you feeling?
I was totally depressed, I started to fight for each and everything. When my family members, talk to me, I just fight with them, and, I shout like anything, because I wanted to, get away from that place and come out of it. And I want me to get treated in a best hospital. And that was a new disease which started spreading. So even my parents and in-laws, my husband, they were aware of that thing. So even we were not financially stable, because all the hospitals, private hospitals, they started demanding for more money. Like in the initial stage itself, we have to pay somewhere around 2 to 3 lakh, which was, was a very toughest point. So, only one thing which came to my, I was very anxious, and I thought whether my baby is alive or not. I started, to self check myself whether my baby is, moving here or there, or a lot of things. I started, asking my parents, doctors, and, my friends, to whomever I can ask. I started talking to them. I asked help, and it was such a toughest situation in my life, and somehow I managed to be there for five days, and then I started fighting with the hospital staff and to the doctors and nurse, and then I came back to my home. And when I came home, I was not happy again, because at least I was there in a hospital setup. Something happens to my baby or to me, they will do something. But in my house setup, I cannot, get help or go.
I will stop you here. And I have really, really appreciated you sharing this situation with us. And that is going to help us to explain your vicious cycle of depression at that time. So you were experiencing lots of unhealthy thoughts.
Exactly.
You were thinking that my husband is not supportive.
Yes.
You were thinking that I'm going to lose my child. You were thinking that whether my child is alive or not in my tummy. You were thinking that this place is not hygienic. And then you were experiencing lots of unhealthy emotions as well. You were anxious, you were worried, you were sad, you were depressed. And then what was your behavior? You were fighting with your husband, family members, arguing with your parents. So you get caught in this vicious cycle of depression. Lots of unhelpful thoughts, lots of unhelpful feelings, and lots of unhelpful behavior. But you were a woman who was empowered. So you decided and you took the step and you decided to come out of that hospital and go for wherever you have given birth. And hopefully everything is right with the baby.
Yes, now she's doing
Congratulations. So just imagine that if a mother who is not empowered, who cannot take things in her own control, she will remain caught in that vicious cycle of depression. So through this Thinking Healthy program, we help the women to break their vicious cycle of depression. And we are going to discuss how we are going to do that. But I hope now everybody understands this vicious cycle of depression, how your thoughts, they impact your feelings and your behavior. If it's not clear now, please let me know, because we really need to understand this vicious cycle of depression to understand this intervention.
Yes.
Thank you very much. Sorry, I have to skip these role plays, otherwise we'll not be able to do it. I will be sharing this presentation with you. So when you will be training, then you have to go through these role plays where people can work in group and they will do these role plays. Okay. So there are some things which are very important if you have to deliver the Thinking Healthy program. Sorry, this is a new topic. Is everybody all right? Do you need 5-10 minutes break, or shall we continue? Please let me know, because I would rather go with your decisions rather than my decisions. This is a group of very empowered women. I don't want to enforce anything.
Maybe we can take break at 3 o'clock.
Okay. So
After
please,
2 hours.
Najiya, do indicate me whenever it's 3 o'clock. Otherwise,
sure. I mean, is it okay with the facilitators, the whole team? This is just my opinion. I also want to know others.
I think 3 is fine.
Okay.
Yeah. 3 is fine. Yeah. Another half an hour.
Another half an hour. Excellent. Oh, hopefully then we will be able to cover one more topic before that. Excellent. So now we have understood the vicious cycle of depression, how our thoughts are linked to our feelings and then our behavior. Our next topic is the things which are very important for the person to understand, whoever is delivering this intervention. The first one is the empathy. Empathy is the ability to place oneself in another's position and to understand and feel what other person is experiencing. And in order to empathize, the first most important thing is to listen with care and attention. Unless you are listening to someone, giving your 100% attention, you will not be able to understand what the person is going through and how that person is feeling. So empathetic listening is very important. So in order to do the empathetic listening, you also need to understand how you are sitting as well. Here, this sitting position is called solar, where you sit and face the person you are talking to. And it's best if we don't have anything between two persons. So no table, nothing, just these two people sitting opposite to each other. And of course, with the pandemic now, there need to be a safe distance between two people. So they can't be sitting too close and or too far, but whatever is advised by your workplace. Then the body posture should be open. So the person should not be sitting with the arms crossed like this and legs crossed like. So they should be having the open body posture. They should be leaning slightly forward towards the person. That gives the impression that the person is really interested in you, what you are saying. And there need to be an appropriate eye contact. How many times these days when you are talking to someone and they are looking at their mobiles or looking somewhere else, that's not empathetic listening. That's not listening anyway if you are not making the eye contact. Then you should have a relaxed body language. You should not be tense, because if you are tense, that can make the other person tense as well. So these are the things which I would like you to start practicing in your day-to-day life now. So next time when you ask your friend how they are doing, listen to them with empathy. Listen to them with care and attention. Make an appropriate eye contact. Lean slightly forwards towards them. You will see how big difference that is going to make. Another thing which is important for empathetic listening is asking open-ended questions. So instead of saying, "Are you all right?" ask, "How are you feeling today?" So just imagine if you meet someone and the other person asks you, "Are you all right?" 9 out of 10 times we are going to say yes. Because just the way the question is asked, you can't say no and then you start saying things. But if a person has asked, "How are you feeling today?" there are more chances that we will actually tell the other person how we are feeling. So if somebody has asked, "Have you got a solution to your problem?" we will either say yes or we will say no, and that will be end of it. But if we will ask, "What are the likely solutions of your problems?" then the chances are more that the person will actually think that what are the solutions of a problem, and then the person will answer you. Does your family help you with the housework? Either yes or no. How does your family help with the housework? Do you worry about your children? So either yes or no. What is worrying you about your children? Do you feel better after taking your medication? Yes or no. But how do you feel after taking your medication? So the open-ended questions, they give the other person opportunity to talk. And again, this is something which we need to get used to of. So when you are talking to someone, just think that how many close-ended questions you are asking and how many open-ended questions you are asking. So when I ask you that, do you want the break now? The answer could be yes or no. But the right answer would have been that when would you like to have your break? So always keep on checking yourself. Always try to ask open-ended questions. Yes, please. I can see a hand raised.
No, it was just a simple tip. When we say problem, it has a negative connotation. When we put it like as a challenge or difficulty, you are much more open to exploring solutions.
Yes, that's very good point. Yes, you can ask that what are the likely solutions to your challenges. Are you referring to this question? Or? Yes.
Yes. Instead of problems, these words can be much more
excellent.
positive.
Excellent. That's a very good point. Thank you very much. So, because while you are receiving this training, I would like you to look the things which you are doing so that you can slightly improve them if there is a need for improvement, so that when you are training the community health workers, you can ask them to also practice it during their training as well. So is this clear to everyone? So open-ended questions are very, very important when we are doing empathetic listening, because that allows the person to talk more and to share with you more of their challenges or problems, and to think and be more elaborate with. So I was walking with my friend last week, and she asked me, because I do take some medications, and she said that, oh, do you have any side effect of these medications? And I said, yes, I do have pain in my fingers, and I have disturbed sleep. And she said, oh, yes, I also have disturbed sleep, and I also have pain in my fingers. So she did not actually acknowledge what I was saying. She completely undermined it. So you have asked that question. So let me tell you. So again, this is something, if you have asked the question and somebody is saying you things, just listen with care and attention. It's very important. It's not just ask the questions and not listen to it. Listening part is equally important. Then it is very important to feel what the other person is experiencing and communicate to her. Communicating is very important, because many times we do feel that the other person is feeling sad, or the other person is feeling upset or angry, but we are not very good at communicating back to that person. So I have given this example here. So this is a depressed mother who is saying that I am experiencing so much stress these days. My husband has lost his job. I lost my mother last year. And these headaches, I have them so often. So the community health worker who is doing empathetic listening has responded back to her saying that I am feeling really saddened by what you have been going through. All this must be too hard for you. So in the empathetic listening, you feel what the other person is experiencing, and then you communicate. So she has communicated, she has acknowledged that this is the mother who is feeling too hard. This must be all too hard for her. And sometimes when people, they share their sad thoughts, their problems, their challenges, we also feel, that also makes us feel sad or upset. So if this is happening, just share.
Yeah, I have a thought about this.
Yes, please.
Yeah. When the facilitator says, I am feeling really saddened, doesn't it look as if this is a situation, yes, you have to be sad to, we are also accepting it. as a facilitator or as a helper, are you able to
Yes.
understand my question? Am I right?
Yeah. So what I have understood, you're saying that if you will say that whatever the mother has said is making you feel saddened, that may not be a good impression for the mother, because then she will think that, oh, I have made this person saddened.
No. That is, it is right to be sad. I mean, we'll have to actually help them to come out of it.
Oh, yes, that it's all right if you are feeling saddened. Yes. So when you empathize,
Aparna, it's also to acknowledge the person who's telling you, they are experiencing these kinds of situation.
My question is, they're already. I'm having some network issue. Am I clear here?
Yes, you are clear.
We can hear you. Yeah.
Okay. Please, can you please repeat?
Now the voice is not clear.
Maria.
Aparna,
Okay,
hi.
Carry on. Maybe I will put it out to as a question.
A best way to do this would be to type it out on chat, so we won't miss anything that you're trying to tell us. Thank you.
Yes, I understand.
Sorry for very well, but maybe
no problem. I'm
when
very sorry for the interruption.
No. Please don't say that. Just write it there, and maybe when we are going to other slides, maybe your question get answered. Another thing is that when you are doing empathetic listening, you have to give minimal responses. So you will say, all right, yes, So it is very important, because that helps the mother to know that, yes, she is being listened to. So sometimes you nod your head, sometimes you say, all right, whatever you say when you listen to someone. So minimal responses are very, very important. Another thing is to acknowledge their feelings. So this is also very important, to acknowledge what the mother is feeling. So I'll tell you this dialogue here. Here the depressed mother is saying that you are hearing all the time about the mishaps during delivery. I feel scared that something bad might happen to either my baby or me. So acknowledging that she is fearful is very important. So it is important for the community health worker to say that you are fearful of your and your baby's safety. So if a mother is saying that she's crying all the time, she's worried all the time, she doesn't know what is going to happen, it is important for a community health worker to say that, yes, you are feeling anxious, you are apprehensive of your future, you don't know what's going to happen. So when you acknowledge somebody's feeling, it just gives them a lot of, it helps build their relationship with you. It helps them to know that you have understood what they are going through, how they have been feeling. Another thing which is important is to summarize what they have been saying. So, for example, this depressed mother is saying that I feel sad all the time. It is getting more and more difficult for me to look after my children. I am really worried now. How will I be able to manage the work if my condition keeps on getting worse? So after listening to her, the community health worker said that you are not feeling well and finding it hard to look after your children. You are worried about how will you manage your responsibilities if your health deteriorates any further. So after you have listened to what the mother is said, it's important if you summarize it in your own words. And when you are summarizing it, you are also acknowledging what the mother has said. The problems which the mother is going through. And when you summarize it, again, it helps the mother to know that you have actually understood what she is saying. And sometimes if they listen again to what they have said, it helps them to think about it more and to correct you if you have not said right. So remember, building an empathetic relationship is very, very important. When I started my therapy work, my supervisor said that it's very important if you touch the heart of the other person. If you manage to touch the heart of the other person, then you build that empathetic relationship. And once you have built that empathetic relationship, then the mother will be able to trust you. The mother will be able to share your problems, share her problems with you. So empathetic listening is very important. Acknowledging their emotions. So again, this is something which you can practice. So if you're visiting your friend or a family member and the family member has told you and they have shared any feelings with you, acknowledge it by saying that, oh, so you were worried about it. Oh, so you were anxious about it. You were scared. You were feeling scared about it. You were feeling low today. You were happy about it. So acknowledging the feeling is a very powerful thing. And sometimes what they have said, how that has made you feel is also very important. Then you develop that connection with them. The more strong that connection is, the better you will be able to deliver this intervention. Sometimes just when people are telling their problems, the first thing we start doing is suggesting them that how they can overcome it. In the empathetic listening, you don't give them suggestions. You don't give them advice. You only listen to them. We all are in the helping professions and we all are used to start giving suggestions or advice at how they can overcome the problems. And that is how majority of these community health workers are trained. As soon as the mother will say that, oh, I'm having headaches, backache, they will not acknowledge what the mother is feeling or what problems, will not explore much more. They will suddenly come up with start giving the advices. Also, if you are having the back pain, you should not lift up heavy weights. You should go and see your doctor. You should start taking this medication. No, this is not what need to be happen. When you are building this empathetic relationship, you are not giving any suggestion. You are not giving any advice. You are only listening to that person. Any question?
There was a question on chat.
I
kind of just addressed that. So she has mentioned to a depressed mother, shall we reply, don't worry, your mother will be reborn as your child, your husband will get a job soon, keep tension free, your headache will go out, it's not good for it's good for the baby. Probably she meant not. So I just responded to her saying that, just restating what you said, have a minimal response and say only things that you're sure about rather than giving an advice.
Yes. So what you have said, Amita, is you have said all the suggestions and advices which the community health worker can give or you can give to the mother. That don't worry, these headaches will go, it's not good for the baby. So when we are developing this sympathetic relationship, we are not going to give any advice. So just say to the mother that it must be very difficult for you because you are going through so much problems. You are having these headaches. It's not easy. It must not be easy for you to be experiencing all these headaches. If she's saying that my husband that my husband has lost the job, you just acknowledge that it must be very difficult for the family if your husband has lost the job. So that will then encourage the mother to talk more. Now, before we go for a break, I would like to do one role play where one of you could be the depressed mothers. Samita, would you mind to be a depressed mother?
Yes.
And I will be the community health worker.
I have a history, Dr. Najiya. I went through postpartum myself.
Oh, okay. So, and yes, I will be your community health worker and I will be doing the empathetic listening with you. So, we will start. We will have got 8 minutes. We will do this role play before we finish. We will have a break. So, Samita, the role play has started. So, Samita, I am your community health worker. I have been working in this area and I have come to visit you I have been told that you are not feeling very well these days. Would you like to share with me what is going through?
So I feel very disconnected with my child, and I don't have enough breast milk. And my mother keeps telling me that to have good breast milk, I should eat a lot. So I feel I'm overeating. I have also become so fat. I don't know what to do with my body. My baby looks very small in front of me, and I'm not able to. I feel like I'm a big bear in front of my child, and
Okay.
I will harm her when I'm sleeping. She doesn't even drink enough. I feel that everything is going wrong for me, and I'm not like my friends who were having so much milk and who are so good mothers when their children were born.
Okay. So, Samita, you are going through a lot from what I am hearing. So, you are not feeling that connection with your baby, and you are feeling as if you don't have enough milk, you are not feeding your baby well. You are very upset about it. And as a result of this, you are eating more and you are gaining weight, and you feel that you are not doing as good as the rest of your friends. This must be very, very hard for you. So how are you feeling about this when you think that all of your friends are doing better than you are not doing as good as your friends? How does that make you feel?
I feel very jealous of mothers, the other people who are having enough breast milk supply and I'm not. And I'm trying my best to do everything, but my baby is not feeding enough. So it makes me feel that I can't even take care of my baby. So am I? Why did I even have baby if I can't take care of it? Maybe I was wrong decision.
Okay, so you have even started doubting your decision of having this baby because of all these emotions you are experiencing, and you are feeling a bit jealous of the other mothers who are able to feed their baby well, because you feel that you don't have enough milk, and it's not good for your baby because your baby is not being fed well. This must be very, very hard for you, Samita, to be experiencing all these emotions, to be thinking about all these things. Must be very hard for you. So what are you doing about it?
I cry only. I feel like crying most of the time. But my mother tells me not to cry because if I cry, then my milk supply will further become less. And I just sit every day staring at my baby, changing her diapers and nappies.
This even listening to you is making me feel really upset and sad, Samita. How hard this must be for you, because you want to cry, and even your mom is not allowing you to cry because she's saying that if you cry, it's going to impact your even breastfeeding even more. You will not be able to produce even enough milk, and it must be very hard for you. And how old is your baby now?
She is 1.5 months old.
She's 1.5 months old. Okay. And how is the baby doing?
She's underweight, and she was born with a pneumonia, and it was very tough for her to feed the initial few months.
Okay.
So she just was not breathing sometimes. So it was very traumatic for me. This is all true. So I'm getting very going back to my old this one. So yeah, it was very traumatic at that time.
So I can't even imagine how difficult it must have been for you, Samita, to have this baby who is underweight, who had pneumonia, who is not drinking enough milk. It must be very, very challenging for you. And thank you so much for sharing with me. I have really appreciated that. And hopefully we will be working on it. And hopefully this intervention which I have brought for you, hopefully that's going to help you to address some of your challenges. But thank you so much for sharing with me. Thanks. So thank you so much, Samita, for sharing this. It must be very hard for you at that time. And I hope baby is all well now.
She is okay, but she still has a difficult breathing issue. And I somehow think it's related with my anxiety and everything. I still carry that trauma with me. Something which is not gone, but this is my personal story.
Thank you so much, Samita, for sharing this personal story. We have really appreciated that. And just imagine that how much pressure a mother is going through. And at that time, if a community health worker will start saying to her that, oh, you should be producing more milk, you should not cry, just be brave, that things does not help at that time. But somebody just listening to what the mother is going through can make a huge difference. Empathetic listening is a very, very powerful tool. Do not underestimate its power. Somehow we start jumping and start giving the suggestions, start giving the advices, and does not give mother enough space to talk about her problems. Just by giving minimal responses, just by acknowledging mother's emotions, just by summarizing what she has said, really helps her to connect with the person there. And that connection is very important. Unless that connection is built, things are not going to be changing. So just imagine, Samita, I believe that people, they used to give lots of advice to you at that time. And those advice would have been making you feel even more overwhelmed.
It was very difficult because I think I have all the Mossies, we call them Mossies here, the attendees. I think I have displayed my breasts to all of them in the hospital with my first child. Everybody tried their hand. It was very, very traumatic for me at that time. So I have shared my story with Maria here. So she's been very empathetic actually. When we started the MMH, this was one of the reasons we both connected on it. So it was very traumatic, but I've tried to overcome it in using my own ways.
Excellent. That is because that is where, when people who are more educated, more empowered, they have got more support around them, they are better able to overcome it as compared to those who are not empowered and don't have much information. But thanks a lot. It's a nice time to have a 10 minutes break. So we'll be back in 10 minutes. And hopefully,
so Dr. Najiya, there's a question by Dr. Apana. Shall we
yes, please. What's the question? No, please. Is it, when they say things happen to me, made me sad as a physician, should we accept? Yes, it should have made you sad verbally by us. I mean, yes, if for example, like when we are just doing this role play, but when Samita was saying all these things, it was really making me feel sad for her. I was feeling overwhelmed actually because of the so many problems she was telling me. So it would have been all right if I would have said that from what you are telling me, I'm really feeling sad. And
with the small session that Smita and you had, I totally it totally answered my question.
Sorry, has that question been answered?
Yes, she said our question has been answered.
Thank you.
The role play session clarified her doubt.
Excellent. Thank you very much. Take care. 10 minutes, please. Be on time. Our ground rule. Bye.
Bye. So I request all of you to stay connected. Do not leave the meeting. Keep your videos and audios off. The recording is paused for now.
Yes. So I hope everybody is back. So another thing which is very important to build that empathetic relationship is by being non-judgmental. And believe me, it is very, very, very difficult. because we are so used to of making judgments that it's unbelievable. If we see a woman smoking cigarette, we have our own judgments. If we see somebody dressed up in a different way, we start judging them. So it is a very, very conscious effort to stop yourself from judging. And again, this will be a big challenge for you guys to be training the community health workers to not to make any judgments. So again, this is an example where a mother is saying that my mother-in-law treats me badly, and the community health worker responded to her by saying that you must be doing something wrong to upset her. This is a very, very judgmental statement. Then the mother is saying that my mother-in-law treats me badly, and the community worker said that she must be a bad person to be treating her daughter-in-law harshly. Again, this is a judgmental statement. So when you are building that empathetic relationship, you need to understand more their feelings and their thoughts. So here, when the mother is said that my mother-in-law treats me badly, the community health workers replied by saying that it must be hard for you. How does that make you feel? So she is not making any judgments towards the mother-in-law, but she is trying to understand more about what experience mother is going through because of that, and how is that making her feel. So again, as your homework, if you see something or if you hear something, and if you are making some sort of a judgment, just recognize that and acknowledge that this is what you have done. Recognizing and acknowledging is step one, and then only we can change ourselves. Also, it's very important to give positive regard. And how do we give positive regard? Is by suspending our judgments, by not criticizing. So, for example, when Samita was saying that she could not produce enough breast milk, and if somebody is saying to her that, oh, because you are not eating the right diet, or you are not looking after yourself, or because you are crying, or because you are worried, these are all the judgmental statements. But if somebody would have asked Samita that how did that make you feel? And then that is a non-judgmental statement that will allow Samita to talk more about the problem which she is experiencing or the feelings which she is going through. Then valuing the mother, which enables her to value herself. So this is also very important, to value someone. Majority of the women which I work with, they have not been valued. Nobody appreciates them. So maybe you are the first person in their life who is appreciating them and who are valuing them. Then it is very important to provide the mother with the safe space where she feels comfortable disclosing her problems. And one thing which we need to remember is that everybody has got the potentials which they can use for the personal growth. What they need is the right environment. So when you provide the right environment, it helps the mother to look for the options which is available to solve that problem. You encourage her to find the problem solutions. And then being genuine is also very important. When you are real, when you are genuine, if you are praising someone, you are praising them genuinely. When you are listening to someone, you are feeling sad. It's not that you are pretending that you are feeling sad, because other person can really pick that up. You really have to develop that relationship where you are feeling that person's emotion as well. You have to give that support without pretending, so that the other person could be real to you as well. The other person will not pretend. Then the second important thing when you are delivering Thinking Healthy program is your good communication skill. The first one is building that empathetic relationship. The second one is to have good communication skills. And what that involves is that whenever you are going to meet the mother, you build that initial contact, that initial rapport. Start with your usual greeting. Acknowledge the presence of others if other family members are present. Always speak in a soft and friendly tone. So most of the time, the relationship which our community health workers have with the mothers, it's more like a teacher-student relationship, where they are very directive, telling them, you have to do this, you have to do this, you should not do this, you should not do this, and that's it. But that's not the empathetic relationship. You need to be mindful of the seating as well. Sometimes if they are sitting on a chair which is higher than the person whom they are delivering this intervention, that is not good. The sitting position needs to be at the same level, equal level to each other. Appropriate eye contact, we have also discussed before. Also, it is very important to tell the mother that whatever she's going to disclose to you is going to remain confidential. And of course, there is always exception to this. If a mother discloses anything which suggests to you that she might harm herself or others, then you have to disclose the confidentiality. Otherwise, other than these two situations, whatever she's discussing with you is going to remain confidential. And just, you are not going there as an expert. The mother is an expert in raising the children, and you are going there to support her, to give her some additional information. Always summarize what she has said, and always listen first. Then give her the opportunity to explore the options, and then offer advice. So advice should not come straight away. As soon as you have listened to someone, you start giving them advice. That is not a good practice. And how much you are doing this in your day-to-day lives. If your friend comes to you and if they start telling you their problem, do you start giving them advice straight away? If this is happening, then you might slightly need to change it. Listen to her first. Provide her that empathy. Ask open-ended questions so that she can come up with her own options. And then maybe you can give her the advice. Stay positive. So sometimes when you're delivering this intervention, you don't find the results straight away. It's not that you have given somebody a painkiller and the pain will go away. It is going to take some time. But your staying positive is very important. Praise them. Praising is very important. That really encourages the other person. Arrange the visits in consultation with the mother and the family. What is the best time which suits the mother and for the mother to receive this sessions? And it's also important to ask if they have any questions. So this group is really unique in a way that they vary in the work which they are doing professionally. So how much of these communication skills we are using? I visited a doctor in Pakistan a couple of months back, and while I was talking to the doctor did not look at me even once. The doctor had her eyes on the laptop, and I don't know what that person is looking in the laptop. He listened to my problems. He did not ask me much questions, and then he just gave me the prescription, and that's the end of the consultation. That was a very, very bad consultation. Without looking, without acknowledging all my problems, without asking any open-ended question to me, and then handing over my prescription at the end. He did not give me any opportunity to ask any questions. So that should not be happening when we are delivering the psychosocial interventions. Any questions? Good. So how many of these communication skills and this empathetic listening skills are we using now when we are with our clients, patients? Is there anything which we realize that we are not doing much and we should do?
Of course, yes.
Would you like to pinpoint anything which you feel that you need to be doing more now when you are talking with your patients?
No. Not talking with the patients. Irrespective of anybody, even as you addressed, even when a friend comes, better to stop giving the solutions rather listening to them more. So that needs to be done. So I thought that I can do with everybody, even in the family. That will bring a lot of harmony to the family.
And thank you so much for sharing this. And exactly this is what is happening when my children, they talk to me. As soon as they tell their problem, I start giving them suggestions. And now I'm trying to consciously stop myself, listen to them. Maybe they don't want the suggestion. Only they want is to off-burden themselves. So it's very important. Thank you so much. Okay. So, okay. So we have briefly talked about the link between our thoughts, our feelings, and our behavior. So the Thinking Healthy program is a cognitive behavior therapy based program. They have used the techniques of cognitive behavior therapy. And cognitive behavior therapy is a talking therapy, and there is a lot of evidence behind it that it's good for depression, anxiety, and other mental and physical health problems. It focuses on the current problems, not the issues of the past. What is the problem which mother is experiencing now, and how those problems can be addressed? And it is again based on the concept that how our thoughts, feelings, and actions are interconnected, and how they can be changed. So there are two ways of breaking this vicious cycle. One way is by changing what the mother is thinking, and another way is by changing what the mother is doing. So in the Thinking Healthy program, we are also focusing on changing the mother's thoughts and changing her behavior. If we change this, then we will break this vicious cycle. Or if we will change this, we will break this vicious cycle. Okay, I will give you an example. Suppose if I am walking down my lane and it is dark, I'm coming back from work, it is around 7 o'clock in the evening, nobody's there in the street except me, and then I start hearing the footsteps behind me. If I'm thinking that this must be a burglar who wants to snatch my bag, how will that make me feel?
Fear.
I will feel fearful,
uncomfortable.
Yes. And then what will be my behavior? That I will start walking fast. I will also experience some bodily symptoms. Maybe my heart will start beating more. I will feel sweat in my palms, and then I will start walking fast. Now, it's the same situation. I am coming back from home after work, 7 o'clock, dark, and I hear the footsteps. Now, if I will think that this must be somebody who is coming back from work, must be my neighbor, then how I will feel? I will not feel fearful. I will just feel normal, and I continue walking in the same pace. So just by changing my thoughts, I have changed my behavior and how I'm feeling. So sometimes changing your thoughts can help you break this vicious cycle. Also, changing your behavior can break this vicious cycle as well. So, for example, if I'm thinking that, I have a friend, what is the name? Shazia, and she doesn't like me. So if I'm thinking that Shazia doesn't like me, she doesn't want to be my friends anymore, I will feel very sad and I will feel very upset. And then what will be my behavior? That I will not contact her. I will not phone her. I will not message her. Now, just by changing my behavior, I can change this. So suppose if I decide that no, let me talk to her and see, maybe she likes me and she wants to be friends with me. And then I called her and then I spoke to her and she was very nice to me. So by changing my behavior, I will be able to change my thought that no, actually she wants to be my friend, and then I will feel happy. So you have seen that how by changing my thoughts or my behavior, I have changed how I'm feeling. Good. Is this point clear to everyone? Okay. So this is just one point which I want to raise, that by doing this training, you do not become a cognitive behavior therapist. This is just give you a basic understanding of what cognitive behavior therapy is. Because in actual cognitive behavior therapy, there are lots and lots of other things which are involved. So how do we use the principles of cognitive behavior therapy in Thinking Healthy program? The Thinking Healthy program has 3 steps.
Dr. Najiya, can I make one? Can I interrupt for a minute?
Yes.
We have with us Dr. Srividya here, who is a cognitive behavioral therapist.
Wow.
And she is, in fact, going to be one of the prime absorbers of this session and going to relay it to the non-psychological background people very soon in person in Chennai, probably in the next 2 weeks. I am not able to, Srividya, if you're here, I don't know if she introduced herself.
Yes, Smita, I'm here.
Yeah, so she's going to be doing, we have a CBT therapist as well, since you mentioned
Excellent.
about.
So I'm so glad that you are here. Please feel free to add if you feel that I have missed anything. I will really appreciate that.
Yeah, sure.
Excellent. Beautiful. Okay. So Thinking Healthy program has 3 steps, and they have how they have used this cognitive behavior therapy strategy in these 3 steps. Step 1 is that you help the mother to identify her unhealthy thoughts. So what unhealthy thoughts the mother is experiencing? So you use those illustrations, which I will describe later, that how you are going to use it. You use these illustrations to help the mother identify her unhealthy thoughts. So I always refer to these unhealthy thoughts as your enemies. Why? Because they are making you feel sad. And it is important to identify your enemy if you want to fight against it. If you know who your enemy is, only then you will be able to do something about it. So it's very important to identify your unhealthy thoughts. Then once you have identified your unhealthy thoughts, you learn how to replace them with healthy thoughts. And then step 3 is you practice thinking and acting healthy. So these 3 steps. Step 1, learn to identify unhealthy thoughts. Second step, learn to replace unhealthy thoughts with healthy thoughts. And step 3 is practicing thinking and acting healthy. So first we talked about 3 areas of Thinking Healthy program, which were mother's personal health,
Mothers to baby,
relationship with the baby,
mothers with others.
Mothers, excellent. And there are 3 steps as well: learning to identify unhealthy thoughts, replacing them, and practicing thinking and acting healthy. Excellent. So step 1 is you help the mother to identify their unhealthy thoughts. So when someone who is depressed, they develop this thinking style, which is unhelpful, which is unhealthy. So they tend to blame themselves. If anything goes wrong, they blame themselves. If a child falls ill, it's their fault. If a husband lost the job, it's their fault. So they tend to blame themselves. They have a gloomy view of future. They predict that bad things are going to happen. Because someone who is depressed, they are also anxious as well. So they keep on worrying that the child will become unwell, or maybe the husband will lose the job, or the mother-in-law is going to be unhappy with, it's going to be a girl or a boy. So they are always having these unhealthy thoughts about the future. They also have a negative view of how others see them. They think that nobody likes me, nobody cares about me. So they are experiencing, they are thinking that, oh, people, they don't want to spend time with me. Then they don't give themselves enough credit. So even if things are going right, they think that, oh, it's only maybe because of luck or fluke that things are going right. They don't give themselves a credit that they are looking after the children well, they are looking after the house well, they are doing so many things. They just look at those things which they have not done. They also tend to think in extremes. So if things are perfect, so if things can't be perfect, there is no point in trying. Just give me 1 minute. I'm sorry for this. Just 1 minute. I'm sorry for this. So they also give up before they're trying. So I'm not good at things. I cannot be making good food. I cannot be going out doing shopping. So they have all these thinking patterns. And it's not their fault that they are thinking like this. So we should not make the mother feel that, oh, you should not be thinking like this. Because why they are thinking like this is because they are depressed. So you see, if somebody has got a sore throat and they are coughing, you don't say to this person that why you are coughing, you should not be coughing. But when somebody is depressed and they are having these thinking styles, we tend to say, blame them that, oh, you should not be doing this. You should be counting your blessings. That can make them feel even more guilty. So we should know that people can think like this when they are depressed. Likewise, when somebody is depressed, they do avoid meeting people. They ignore their personal hygiene. They tend not to seek medical care because they don't have the motivation. They stop doing those activities which they used to enjoy. They can't spend that much quality time with their children. They can become angry. They can become argumentative. So we have illustrations which you can see in the reference manual. And these illustrations actually help the mother in step 1 to identify their unhealthy thoughts and their unhealthy behavior. In all these illustrations, picture A is about the unhealthy thoughts. Picture B is about the unhealthy behavior. And picture C is to help the mother understand the consequences of unhealthy thoughts and unhealthy behavior. So, for example, in this picture, mother is thinking that if I go out, people will gossip. So there is a child in the pram which maybe needs to go out for immunization, or maybe the child is unwell, she needs to go out to see the doctor. But the mother is thinking that if I will go out, people will gossip about me. And as a result, what her behavior is that she is not leaving the house. So when she is not leaving the house, and if the child is not being seen by the doctor, what could be the consequences that the child can become even more unwell. So you describe these pictures to the mother. There are captions underneath all the pictures which will help you to describe them. And by doing this, what you are doing is that you are helping the mother to understand the link between the thoughts, the feelings, and the behavior. So you can ask the mother that, what do you think the mother in this picture is thinking? Or you can read the caption and explain this narrative to the mother. So after you have explained this to the mother, you do normalize it. Normalizing is when you explain to the mother that sometimes women who are experiencing difficult situations can have thoughts like this or can behave like this. So when you normalize, it helps the mother to understand that she is not the only one who is thinking like this or behaving like this. There are mothers who, when going through a difficult situation, can think and behave the way she is thinking and behaving. After you normalize, then you ask the mother that does she experiencing any thoughts similar to this or any behavior? That will then encourage the mother to talk about her thoughts and her behavior. So first, by explaining the pictures, you have helped the mother to understand the link between her thoughts, her behavior, and her feeling. Then you have normalized by saying that mothers, when they are feeling low in mood, when they are going through a difficult life circumstances, they do experience these thoughts and they do act like this. And then you ask the mother that does she experience similar thoughts or behavior? Samita,
So,
I can see
Dr.
your hand raised. Is this?
Yes,
do you want
I
to
had a
ask?
question and you clarified it.
Yes.
So when we talk about normalizing, we are normalizing her thoughts, not her behavior, not the picture C.
No,
but
we can also normalize behavior as well. So so first within step 1, first we explain this link. Then we have normalized by saying that mothers, we are talking about general mothers, not about our mother whom we are delivering this intervention. We are saying that mothers or women, when they are feeling low in mood or when they are having difficult circumstances, they do experience such thoughts or they do behave in this way. So this will help the mother to know that she is not the only one. Other women can experience, and that will then encourage her to talk about her thoughts and her behavior.
So Dr. Najiya, from what you're saying is like we should use this as an example. Okay,
Yes.
so these certain mothers will go through these. Do you have anything similar to this?
Yes.
Yeah.
Yes.
Am I right?
Yes.
So we can use these flashcards, these illustrations as an example, so that the mothers can get connected. Okay.
Yes.
So I have a question. But
Yes.
what if a mother is not feeling it? For example, suppose I felt very that I'm not good enough for my child, right?
Mm-hmm.
But a mother who is probably going through that I'm not good enough for my husband because my body has become this way.
Mm-hmm.
But if I'm adding on this belief that some mothers feel that they're not good enough with your children, will it not add on to her existing thoughts and say that, oh, I didn't think of it, now I have to think of that also? Will it? How will that work? It will not be counterproductive, right?
That's a very, very clever question. But Samita, I think you should not worry about it. It's not that by saying these thoughts, you are going to induce these thoughts in mother's mind. That's not going to happen. Trust me. I have never seen this
Dr.
happen.
Najiya, had I this 10 years back, I would have been a mother who would have got influenced with everything that, my community health worker must have said. I would have said that, oh, this is happening, that is happening. I'm talking about myself, but probably that's because I'm very sensitive. But I'm just saying that there are people who think like me. So won't it be counterproductive? Is my worry.
So even suppose really, even if a mother will start also thinking like the mother in the picture. Sorry, there was one hand raised. Rashmi, did you want to say something?
Yeah. Probably once you finish this, then regarding normalization only, like, I had a different kind of experience, so I could like share that. Yeah.
Oh, I love those experiences. Thank you. So when you will move on to the step 2, where we will be talking about a mother who is thinking differently and behaving differently. So maybe even if she will start thinking like this, the step 2 will help her to overcome that.
Okay.
Yes, Rashmi, please share.
Yeah, so like, when I was pregnant, and my mother-in-law would say that, like, whatever you were going through, whatever you're going through, other women also went through the same thing, like, or we also went through the same thing during our pregnancy. But then, like, I used to get like really irritated saying that, like, whatever, like, many women go through that, but for me, it is my first time, right? So I would not, like, it was like as if they're minimizing, like, when I would my problem. Yeah, so that is what I would feel at that point of time. Like, for me, it is like all women have gone through that, but like, they were telling me to make me feel like, it's okay, like, it will all pass by. But then I would feel like I am in that phase right now, and like, I am going it for the first time, like, so it's not okay with me, basically.
So this is again a very, very good comment which you have made. So Rashmi, the thing is that we have used this normalization after we have talked about the women in the picture.
Right. Yeah.
And sometimes it can happen if a person is not using the words appropriately, then make the other person feel that you have minimized a problem. But we are using these sentences for normalization after we have talked about this picture. And like, remember when we are talking about this empathetic listening, when the mother is saying her problems, it is very important then the other person should be listening to her with empathy.
Right.
So when you were telling your problems to your mother-in-law, and if she would have been trained in counseling skills, she would have been listening to you with empathy. And you don't have to be trained in counseling skills. People, they do demonstrate empathetic listening anyway, people who are genuinely concerned and empathetic. So and if normalization is not used appropriately, this is what happens, what Rashmi has just shared, that this can make the mother feel that her problem has been minimalized. Yes. So you have pointed it out very rightly. And this is again, you need to be using in your training, that it is very important. The purpose of our normalization is for the mother to encourage, talk about her thoughts and behavior, not to minimize her problems. Thanks. Very, very good questions raised by Samita and Rashmi. And I could see another hand raised. Yes, please.
Yeah. As Rashmi ji shared, I also felt like sharing. So I had a different kind of experience during my pregnancy. I was like very badly nauseating and throwing up each and every time when I used to have a food. So unfortunately, like my mill had a different view. So every time when I like vomit, immediately I have to eat something. I was kind of forced upon. I really didn't know how to handle the situation. So what I would do is, like, whenever I feel like throwing up, I just used to like make sure like I don't make any sound, get into the bathroom silently, do it, come out. So I was so stressful. So yeah, that is like immediately I have to eat something. I was like literally forced. I didn't know how to handle the situation. Yeah. Thank you. Thank you for giving the opportunity to share.
These are some of the myths which need to be addressed in the intervention. So mother doesn't have to eat straight away as soon as she has breastfed. That is not correct. And you have suffered a lot because of that, because then you start to feel nauseating, and then you used to go to bathroom and just vomit. So that was very, very unpleasant, must be very unpleasant for you. Okay. So the step 2 is, you learn to replace your unhealthy thinking with positive or healthy thinking. So again, we use those 3 pictures, different set of pictures, and help the mother again to understand the link between her healthy thoughts, her positive feelings, and her healthy behavior, by making the comparison between the first set of pictures and second set of pictures. So in the second set of pictures, what is happening is, now picture D is again about thoughts, picture E is about behavior, and picture F is about consequences. So in picture D, now what the mother is thinking, that it is okay for me to venture out even if I'm anxious. So what was happening here before? The mother is thinking that if I go out, people will gossip. And that was stopping the mother from going out. Now, here, what the mother is thinking, that it is okay for me to go out even if I am feeling a bit anxious. So, when she is thinking like this, what is happening is that she is taking her baby out for immunization. She is taking the baby to the health center. Whereas in the previous picture, what was happening is she was not leaving the house. The baby was unwell. The baby was just lying on her lap. She did not take the baby out to the doctors. Whereas in picture E, she has changed her thoughts. She has told herself that even if she is feeling anxious, she will go out. And as a result, she took the baby out. And what is the consequences? That she do not have to rely on others all the time for somebody to come and take the baby to doctor or for immunization. So it is important for them to understand the consequences of their thoughts and behavior as well. So after you have explained step 2 to them, you then ask them that is there anything they can do to think differently or behave differently? So whatever example they have given. So you encourage the mother to think differently. Is there any way they can think differently or behave differently? Now there is a very, very important point which I am going to make here. It is not that easy to change your thoughts straight away. It is relatively easy for mothers to talk about their behavior. So if any mother is able to suggest that yes, she could, so suppose if a mother is saying that there is nobody in the world who cares about me. And as a result of this thought, she's feeling very sad. She stopped meeting people. And what is the consequences? That she is losing on her social support. Now, if you encourage the mother to think differently, maybe there is someone who does care a bit about her. It could be her mother, it could be her sister, her mother-in-law, her husband. Maybe there are some people in the world who do care a bit about you. Because it can't be possible that nobody in the world cares, do not care about you. There is always someone who do care a bit about you. So you encourage the mother to change her thought that yes, there is someone who do care about me as well. And then what could be her behavior? That she can try to get in touch with the person, she could try to socialize more, she could try to visit people, she could invite people at their home. And what could be the consequences? That her social support will improve. So even if the mother is saying that no, I think nobody cares about me, I can't change my thought, then you encourage her to change her behavior. Is it possible her to spend, say, half an hour with the family members or to call someone? So when she will change her behavior, the chances are that the consequences will get better. She will be able to get some support. So in step 2, you help the mother to replace her healthy thoughts with healthy thinking through illustrations. Or let's say that if a mother has not been able to change her thoughts or her behavior, just by explaining these illustrations, you have sown the seed. If a mother has failed to tell you any of her unhealthy thoughts, and she has not been able to change her thoughts, just by explaining the pictures, you have helped the mother to understand that if she is thinking like this, if she's behaving like this, this is the consequences. And if she's thinking differently or behaving differently, this would be the consequences. Is that clear? If she has shared her thoughts, very good. If she has been able to change her thoughts, very, very good. But even if she has not been able to do that, at least by using the pictures, you have helped her to understand the link. And you have sown the seed, which hopefully with time, she will be able to identify and to do something about it. Most of the work which the mother does is between the sessions. Please remember that. So you deliver the therapy session, and I think Dr. Siri would like to agree with me. The most of the work happens between the sessions. Yeah. So sometimes they think this is what has been said in the session, this is how I'm behaving, this is what I'm thinking. Is there anything I can do to think differently or behave differently? Any questions?
Dr. Najiya, I just want to have one clarification. So you mentioned that it is easier to get the mother to talk about their behavior first and then root it to their thoughts as to why did you behave like that, right?
No, I did not say that you have to talk about the behavior first. I said that I said most of the times it is easier for people to recognize their behavior more than they can recognize their thoughts. And it is easier for them to identify what they can change in their behavior as compared to what they can change in their thoughts. So, for example, Samita, if I asked you that what you were thinking, what you are thinking now, you might struggle to tell me exactly what you are thinking. But if I ask you that what you are doing now, it is much more easier for you to tell me. So therefore, if a mother is really struggling with the thoughts, then you can ask more about her behavior. And there are examples in the manual as well, which the community worker can use to help the mother understand more. So, for example, the unhealthy thought is that I'm not feeling any warmth.
Dr. Najiya, sorry for the interruption. Following the question by Smita, so it's mentioned in the Thinking Healthy manual that these three steps you don't need to follow as it is. Like you don't need to follow the order. You can change it. So we can ask by what something like what is how you feel instead of how you're feeling today, what you did today. Can it be changed like that?
I think that step 2 cannot come before step 1. The steps need to be following the same sequence. First, you talk about sequence 1, which is unhealthy thoughts, unhealthy behavior. Then you talk about sequence 2. But if you want to ask the mother, usually when we do the mood chart, which I'm going to discuss later, at that time we talk that how the mother has been feeling throughout the week, what she has been doing, how she has been behaving.
So we don't have any flexibility in changing the steps.
The step 2 should come after step 1.
Okay.
See, to answer that, Maria, probably if you want to identify, as Dr. Najiya was telling, the behavior is easy to remember. Probably the behavior can tell them what was the trigger and why did it lead to that, right? If at all you want, you can ask in that way, but probably that sequencing has to be there. We cannot change the steps.
Okay.
Thank you.
And I think if you are a skilled therapist, then you can do, but because you need to give a clear instructions to the community workers what they need to be doing, so it's better if you ask them to do step 1, then step 2, but of course an experienced therapist can do whatever they feel is best for the. Okay, so there are some examples as well in the reference manual in every session. So the session which is linked to mother's personal health has got all the examples related to unhealthy thoughts and how that can be replaced with healthy thoughts. So you can also give example to the mother that I have been working with other mothers who are experiencing similar thoughts, and this is how it has helped them when they have changed their thinking and they started thinking like this. So you can use these examples as well. So a mother who is feeling that I do not feel like interacting with my child, thinking that if I try, I can enjoy interacting with my child. So you can see that it's not that so for example, that a mother who is thinking that I'm not feeling any bond with my child, we don't expect her to change her thoughts by thinking that I have a strong bond with my baby. It needs to be shifted slightly. So a mother needs to be thinking that my feeling for my child will grow stronger with time. Or a mother who is thinking that I'm not a good mother can think a bit differently, that I love my children and I'm trying my best to raise them well. A mother who is thinking that I don't have time to take care about my health, she can think that if I spend small amount of time on my health every day, I will remain strong to look after my baby. So you help them to slightly shift their thinking from unhealthy thoughts towards healthy thoughts. I don't have the confidence to talk about my health problem with my family or the doctor. So a healthy thought could be, if I'm worried about my health, I must talk to somebody, otherwise it may become serious and become a problem for everyone. So there may be someone she can talk to. And then in health, the step 3 is the health charts. Okay, so I would first like to do the role play of first 2 steps. Would that be all right? So in the reference manual, if you open page number 61, this is session 2.2 on mother's relationship with the baby. So these, has everybody opened it?
Yeah.
Okay. So who would like to be a mother in this role play?
I'll do it.
Excellent. And this is Harita. Am I right?
Yes, doctor.
Okay. So, Harita, you are a depressed mother and I am a community health worker. I have come to you and I am now going to do this role play. So, Harita, I am going to show you some pictures and we will talk about them. So, can you see this picture? What can you see in picture A?
In picture A, I see the mother feeling sad, holding the baby, but there is minimal eye contact and minimum bodily touch. And I feel she's very lost.
Okay, thank you, Harita. So as you can see that in this picture, the mother is looking sad. She's not making an eye contact with the baby and she seems very preoccupied. So here, Harita, it is telling us that what this mother is thinking. So in picture A, this mother is thinking that the baby is too young to have feelings for me and all she needs is feeding and cleaning. So this mother is thinking is that this baby cannot recognize my feeling. All I need to do is just to feed her and clean the baby. And when the mother is thinking like this, in picture B, it is telling us how she is behaving. So when she is thinking that it's not important to be interacting with the baby, all the baby wants is just to feed and clean. In picture B, as you can see, she's not interacting with the baby. The baby is just lying on her lap, and again, no eye contact. She's not smiling. She looks very sad. And picture C tells us the consequences. That when the mother will not interact with the baby, when the mother will not play with the baby, if she is not making any efforts, what will happen is that this is going to affect her health and her baby's health. Especially the baby's emotional health and her own emotional health. Because she's not making any efforts to make the bond with the baby. So Harita, sometimes mothers who are going through difficult situations, who are experiencing low mood, they do experience these type of thoughts. And sometimes they do behave, they find it difficult to bond with the baby, to interact with the baby, to be playful with the baby. So I'm just wondering, do you sometimes experience similar thoughts or similar behavior?
Yes, sometimes I do feel the same.
Okay. So would you like to tell me how do you feel or how do you behave?
I feel not noticed.
Okay. Okay. So you feel ignored, as if nobody is taking any notice of you?
Yes.
And can you tell me, Harita, what goes through your mind?
I feel I need to connect with someone. I feel I need to be validated for the work that I'm doing.
Okay. Okay. So you think that people are not giving you enough credit for what you are doing? People are not validating you and they are ignoring you. So when you think like this, how does that make you feel?
I experience anger.
You feel angry?
I resent the space of giving birth and being a new mom.
Okay. And how does that impact your relationship with your baby?
Sometimes I just don't want to do anything for the baby.
So you don't want to do anything with the baby. And then could you tell me what could be the consequences?
Consequences, I mean, the bonding is reduced.
Okay. So thank you very much, Arita, for sharing this with me. So what you have told me that sometimes you think that people are not giving you enough credit, they don't validate you, they are not appreciating your efforts, they ignore you. And then you feel angry, you feel upset, and it does how you interact with your baby, it does impact that, it does impact your interaction with your baby. You don't interact with the baby that much. And what are the consequences? That bonding between you and your baby is affected because of this. So, Arita, thank you. And I am now going to share you another set of pictures. So, if you see on page 62, picture D, what is happening in this picture? How is the mother feeling?
Her eyes are wide open. I feel the mother is much attuned with the baby. There's a lot of mother and baby touch that is going on. And I see a confident and a happy mother, and in turn a healthy baby as well.
Excellent. Thank you so much, Arita. So you see that in this picture, The mother is making the eye contact with the baby and she is smiling and she looks happy. So if we come, and in this picture, what the mother is thinking now is that my baby respond to my feelings and it is good. It is pleasurable for me to be interacting with the baby. So you remember when I showed you the previous picture in which the mother is thinking that the baby does not know about my feelings. All the baby needs is to be fed and clean, and she is not very happy. So, but in this picture, when she is thinking that no, my baby does respond to my feelings. And then she's happy, she's making those interactions with the baby. If you see in picture E, what is happening? How is she behaving now?
There's a lot of bonding that is happening. The mother is happy, the baby is responding, and in turn, the baby is also communicating the happiness through a smile in the face.
Yes.
And the secure attachment between the mother and the baby.
Yes. And this is so different from picture B as well. Can you see, Arita? Here in picture B, the mother is not interacting with the baby. She's upset. Whereas in picture E, she is interacting with the baby. She is playing with the baby. Beautiful eye contact. And then what is the consequences in picture F?
Overall, happy, healthy mothers equal to a happy, healthy baby and
yes,
a very harmonious family.
Yes. So you can see the consequences are that it is having a positive impact on baby's emotional health, positive impact on mother's emotional health. So you see that the mother, by changing her thinking and how she is behaving, is having a good consequences for both the mother and the baby. So Harita, you told me that sometimes you think that people, they are not acknowledging you, they are ignoring you, and your behavior is also sometimes how you have described me, that you don't interact with the baby that much, and then the consequences is that your bonding is getting affected. So is there any way that you can think a bit differently or behave a bit differently?
I can try.
You can try. Thank you. That's really good. And I'm glad that you are ready for trying, because now we are going to move to step 3, and in which we will see what things you can do to interact with your baby.
Sure.
Thank you. So any comments about this role play from the group?
I know it's very good, and all of us could relate as mothers. You know, when we went through that phase, since I had my C-section, and I was not able to feed my child, and I was telling my mom saying, I can't feed. I'm feeling so tired and exhausted. I have bad dreams coming in. I have everyone coming and basically waking me up every 1 or 2 hours just to intervene and check on me. So it's more pain of mine that was overshadowing me to take care of the child. So because you're operated and you first want to get yourself healed. So making bonding with the child for the 3-4 days was very difficult. And the first 15 days was extremely difficult for me to get the baby latching onto my breast and have them get a proper milk. Then after we look at this piece of having your converting that unhealthy thought to a healthy thought, because all the time mother was basically trying and helping me out, and she was helping me roam in with the child and supporting me, and I was always dependent on her to feed my baby, like put the baby near my breast, set the positions for me, hold the baby. So it was very difficult that I always wanted an assistance to breastfeed, and it was a very group support that was needed at that point of time. Slowly, when I was able to understand, and my husband came and told me, it's your child. If you even put it down by mistake, you take the liabilities. Don't feel bad to lift the child since very small. Get it closer to your breast. Until you don't gain the confidence, baby will not reflect back the same thing to you. So it was a lot of the thought that going in the mind, basically made the other things happen. I was depressed, irritated, felt very lonely, anxious. Once I started connecting with the child, I was able to breastfeed the child for good 1.5 years. So it was a good, beautiful journey. So, I could connect to that immediately when you and Harita did that role play.
So it's very important, and thank you so much for sharing your experience. It's the interventions only work when people can relate to them. If they can't relate, then that's not going to be helpful, and that's why these psychosocial interventions which we use for our target population needs to be addressing their risk factors. And like you guys were lucky, you have a support around you which helps you to overcome the depression. But lack of support is a very, very big factor for the risk. And many of these mothers, they are not living in an ideal situation. They don't get that much support from their husbands, their in-laws, their own families. So it becomes very hard. And maybe for somebody who is bringing this intervention to them, that they could make a meaningful difference. So thanks. And Harita, how was you feeling when we were doing this role play? Sorry.
I could kind of relate to a lot of mothers because I'm an antenatal educator and a lactation counselor.
Mm-hmm.
So when we take the history of birth and when we take the history of day-to-day activities that is taking place in the mother's home, sometimes they kind of like they do not make eye contact. They just keep quiet. And when they feed the baby, we can see that there isn't much attunement.
Mm-hmm.
So I find these illustrations to be very helpful. Probably I could actually display all these things to my mothers also. So I think it would impact the breastfeeding rate, and it will also impact the bonding between the mother and the baby dad.
And Harita, when I normalize it, it did not sound as if, because we were not discussing about your problem, so it did not sound as I'm minimizing what you are saying. So Samita, that point was very, very valid, which you have made. And I think during the training, this needs to be really highlighted, because we don't want people to be minimizing mother's problem. When mother is explaining the problem, it needs to be listened with care and attention and empathy, and not minimizing them. And another thing which you might have noticed when Harita said that no, she can't think anything differently, I did not force her to change her thoughts. So I said, okay, then let's see what you can do differently. And that takes us neatly to our step 3 when we set goals with the mother.
There was this empathy, there was active listening, and
non-judgmental.
Non-judgmental listening, and there were also suggestions that were offered in a very, very gentle way that the mother is not like pressured to do.
Right. And also, I wanted to add that when you were talking about normalizing with Harita, my observation was you were normalizing, and I wrote it down, normalizing with stories of generally what mothers face on the thoughts and the behavior that might impact for them. Not normalizing your thoughts, not Harita's thoughts. We're talking about normalizing in general for mothers and their behavior. So somewhere I feel that it was like a third-person storytelling, which kind of took off the weight from Harita's head and saying that, oh, this also happens with other people, and like having like a drone's view of the problem. So I thought that was more the normalizing that you were talking about, not about her problem, but having like a third person. I don't know how to. I'm sorry. I'm extremely. I'm very bodily vocal, so
if you guys will not raise these points up, we will not have these discussions, this whole training is useless then. It's very important, and I'm so glad this group is so open to share their personal experiences. I'm really very, very, very grateful for that. Very grateful.
I was in fact thinking that this is in fact a total role play of the showcasing of the ABCDEF, because when we are seeing it, we are ourselves wanting to talk about it. It's not that you are asking us or, taking it out of us, like how Subhashri shared, how I shared, how, Maria was able to share. I think it's all coming already into action. When you see the pictures, you're putting it in your own life and talking about it.
Okay, then comes the third step. So then, like Harita was saying to me that, I don't remember. But anyway, I said that, okay, let's see how you can change your behavior. So there are different health charts. And in health charts, there are different type of activities which are written. So in the manual, the Urdu version, you can see that these health charts are very clear. And hopefully I will share the job aid English version with you soon. But even by looking at the pictures, you can tell that what sort of an activities the mother is encouraged to do. So let me see what it has done here. If you open, this is session 2.2 on the health calendar. Yes. Health calendar, if you open page number 148, 148. Have you opened it? Yes, thank you. So here you can see the chart of relationship with the baby. And here you set tasks with the mother.
148, I could see an exercise chart. In the
Maybe then it is page, it must be 148 here on my, yes, page. Okay, here are this health chart. This is what I am referring to.
But the 148, are you opening exercise chart or it is different for you?
In the same 148 is what exactly Dr. Najiya showed. 148 PDF.
It's a health calendar.
Exercise chart, and next to it is a relationship chart.
It will be a scroll.
Okay, yeah.
You'll find
Got it. Thanks, Dr. Najiya. Yeah, thanks.
So then you set tasks with the mother. So for example, here, if a mother, you encourage the mother to do this gentle massage on the baby. It says once a day, but you ask the mother that how many days in a week she's comfortable doing it. So you set these tasks in collaboration with the mother. Singing songs to the baby, playing with the baby. So these charts you can adapt according to your own culture and own customs.
Dr. Najiya, I have
some of the suggestions which they have given. Giving massage to the baby, singing or talking to the baby, playing with the baby. How many times she can do it comfortably in a week? What time she can do it? If she feels that she cannot massage her baby, fine. Is there any other activity which she can do? So you encourage the mother to engage in healthy activities because this is the mother-baby bonding session. So here there are activities which are linked to mother, what she is doing with the baby.
Dr. Najiya?
Ji?
I have a small question.
Yes.
We offer these gentle suggestions for bonding with the baby, and if the mother is outrightly refusing, saying that no, and she's not citing reasons, what should be the next step?
Sorry, you have to say your second sentence again, that there are some gender differences in how the mother behaves with the baby.
When we are offering the suggestion and she says that she is not ready to do any of these things and she is not opening up after a point, what should be the way to take it forward?
Okay. So here, if a mother is saying that she doesn't want to engage in any of these activities, you ask the mother that is there anything she wanted to do? Because you have explained to her in step 1 and 2 that how important it is for her to be interacting with the baby and what could be the consequences. So I have never come across any mother who has understood this link and then she's saying that she is not ready to do anything. This is suggesting that either the mother is very, very, very depressed which means that she needs to be referred to the doctor to start some medications as well. Usually, the mother who's mild to moderately depressed, they do want to do some of the activities with the baby. So she can start by just spending 10 minutes every day playing with the baby. Or she can start by doing massage once a week. So no matter how small she's starting with, as long as she's doing something, making small efforts to improve that bonding, that will be helpful. So there are different type of charts here. There is a diet chart. So if you open page number page number 137, there is a mood chart which we will discuss later. There is a diet chart. So in the diet chart, which is related to session linked to mother's personal health, you discuss with the mother what food she is eating. Is there any way she can improve her diet? So again, first question when setting up the diet chart is what food mother is having for her breakfast, for her lunch, for her dinner. Is there anything which she can eat to improve her breakfast, lunch, dinner? Sometimes the mother says that we don't have much food at home. We can't afford to eat egg. We can't afford to drink milk. We can't afford to have proteins. But then you talk about different alternatives. If she can't afford to eat, to drink milk, is it possible to drink like half a glass of milk with added half glass of water? Are they able to drink lassi? You know what lassi is? Yogurt drink. Are they able to put little bit extra milk in their tea? If they can't afford to eat egg every day, is it possible for them to eat one egg in whole of the week? If they can't afford to eat any fruit, is there any way that they can eat some more vegetables? So when we talk about balanced diet, we are not talking about expensive diet. What we are talking about is whatever things is available to them at home, they can use those things to make their diet more balanced. Instead of eating a pack of crisps, can they eat carrot? Seasonal vegetables are usually much cheaper. So they need to be understanding the importance of eating healthy diet. So I usually give this example that if you have got one apple and you have got 3 children, make sure that you cut that apple into 4 halves so that at least you can eat 1 half as well for the baby which is inside your tummy, because that baby needs nutrition as well. So you highlight the importance of having healthy diet. And when you are highlighting the importance of healthy diet, it's good if you have mother-in-law sitting there as well so that she can understand. And when you link mother's health with the baby's health, this is also very important. So you highlight that it is very important for a mother who is pregnant to be eating well, because all the nutrients are going to the baby as well. And after the baby is born, if the mother is breastfeeding, if she will eat well, the milk is going to be more nutritious for the baby. So when you make this link between mother's health and the baby's health, the families, they tend to support the mother more. And mother also feel more motivated to improve her diet, because she knows that it is very important for her to be eating well. I remember delivering this intervention to one of the mothers who was told that by her mother-in-law that she should not be eating more, otherwise her labor is going to be very difficult, because she does not want to give food to the daughter-in-law. So highlighting the importance of balanced diet is very important. Any question?
Yeah, Dr. Najiya, like for our cultural setup, a session on the belief system, I think that is also very important, right?
Very, very important. So if people have these myths and misconceptions, it is very important. So you don't need to have a separate session for that. But if you know that, for example, if it's a session on mother baby bonding, and you know that there are certain myths which are not correct, then you need to be discussing it while you are showing the pictures in step 1, step 2, or maybe step 3. Because one of the common practice in Pakistan is that a child is baby, after the baby is born, is given honey or something sweet.
Yeah, that happens even in India. Sugar water.
Sugar, yeah. So that is not good for the baby. The best thing for the baby is that the first milk which the mother produce, that is the best goopy. So maybe in this intervention, you need to include that as well, that the baby should not be given honey or sugar or anything. And then one of the eldest member of the family, without washing their hands, come and put their finger in baby's mouth with the sugar or honey on it. So that's not good for the baby. So we need to be addressing these practices which are not correct. So that's a very good point which you have raised. So one of the biggest challenge which our community workers face when they are doing this diet chart is when mother says that they don't have much food at home. They can only afford to have breakfast and one another meal. They can't eat anything in between. But then encouraging them to think of any possible ways that they can improve their diet. Then we have rest and relaxation chart. If you see page number 139, it has breathing exercise. It says here 10 to 15 minutes, which is not correct. It should be like 3 to 4 minutes or 2 to 3 minutes. So you can teach them how to do breathing exercise, which is very, very, very good for to reduce your anxiety. Then for rest and relaxation, they can go for walk, whatever things they can listen to music, they can sing. Sleep is also very important. So you discuss all these activities with the mother and then set these charts. And please, if you want to change them according to your own cultural practices, do change them. How do you relax? When you want to relax, what do you do? What do mothers, what do your target mothers do when they want to relax? So therefore, it is very important for you to have a very good understanding of your target population as well. Okay. Do women over there, they do go for walk if they want to relax? What do they do? What do they do most when they want to relax? What do you do when you want to relax?
Listening to music.
Yes.
Sleep.
Sleeping.
Sit and do nothing.
Sorry, say that again.
Sit and do nothing.
Do nothing, just sit there, yes. If that is how someone likes to relax, or watch TV, or go for a walk, or breathing exercise, or yes. Good. So please add all these things in your charts. Okay, so this is, I think, something which, Maria, you were talking about, the flexibility in the use of the 3 steps. So step 1 and 2 are difficult to practice. They can be simplified by drawing so this is what I was saying, that you don't have to force the mother to change their thoughts. Just drawing the attention to mother and families to the characters in the picture, pointing out to the differences in which they are thinking and their consequences. And by doing this, you have planting the seed of alternative thinking and behavior. Excellent. So maybe you need to change some of the captions which are underneath the pictures to make it more relevant to your culture. And another thing is, I'm going to share you the mistakes which have been made in this manual. because the picture B should be talking about the behavior, but some of the captions underneath picture B, the way it has been written is, it seems as if they are again talking about the thoughts. So picture B and picture E are always about the behavior, what the mother is doing. Picture A and picture D is about the thoughts, and picture C and picture F are about the consequences. So now we will come to session 0, which is the introductory session. What I have discussed so far, is it clear to everyone?
Yeah.
Anything which you would like to discuss more, or any questions? Okay. Good. So have we got all the background understanding now? And now we are going to see how we are going to deliver session 0. We know by now that Thinking Healthy program has 3 areas of well-being: mother's personal health, mother's relationship with the baby, and mother's relationship with people around her. How these 3 areas have been decided? Because of the extensive qualitative work in which we ask the depressed mothers, their family members, primary care health doctors, community health workers, that what problems mothers experience when they are going through depression. And by doing the thematic analysis of these problems, we found out that these are the 3 areas which get affected the most. And then we know by now the relationship between thoughts, feelings, and behavior, and how by changing our thoughts or by changing our behavior, we can change our feelings. We have talked about 3 steps of Thinking Healthy program: learning to identify unhealthy thoughts and behavior, replacing unhealthy thoughts and behavior, and practicing healthy thinking and acting. We have seen that there are illustrations to help the mother do step 1 and step 2, and there are health charts which helps the mother to do step 3. And when you are setting the chart activities, they need to be set in collaboration with the mother. You are not going to say to the mother, you should do this, you should do that. So this is very important. Before we start our introductory session, I would like to, you guys have a little bit of break so that whatever we have discussed get absorbed in your minds, and then we will come back. So is this the lunch time, dinner time? What time it is there in Chennai?
4:35.
Tea time.
It's like chai time.
Chai time.
Chai time.
Okay. Okay. So would you like a half an hour break or 15 minutes break?
Half an hour.
Say that, half an hour. Okay. So we will have half an hour break. So let's say it's 11:06 now. We will get back at 11:30 my time. So after 25 minutes. Happy breaking, happy drinking tea. We will be back and also do some exercise. Bye.
Yes.
Bye.
Be meeting the mother. So this will be the first time when the community worker will be meeting the mother. And the purpose of this session is to engage the mother and family in the program, provide them some psychoeducation, explain what Thinking Healthy program approach is, and establish the ground rules. Okay. So when you are introducing Thinking Healthy program, it is very important that you introduce it in the simplest possible manner and not to use any jargon words or stigmatizing words. So jargon words is like psychosocial intervention. Stigmatizing word is like depression, anxiety. So just simply say that this is the intervention for mother and baby's health and well-being. So just this simple sentence, however you are going to say that in your language, that it is the intervention for mother and baby's health and well-being. How do you say that in your language? That this is a program for mother and baby's health and well-being.
So the program is called Thai Nalam Podu Nalam, which means that mother's care is care of not only the infant, but it also is the care of the entire community. Because from the child, then the family, and then the community. So we can say that Thai Nala, that is, if the mother is good, and the child will also develop.
Okay. So, but when you are introducing the program, you say that this is the program for mother and baby's health and well-being. As simple as that. So you will not say that this is the program to address mother's depression. What you are saying is that this is the program for mother and baby's health and well-being. It is delivered from the time when mother is pregnant until the baby is 3 months or 6 months old. And it has this many number of sessions. This is something which we will discuss later, that how many sessions your community worker will be delivering. And we will be delivering this intervention to you at home. Then you start explaining the benefits of this program to the child. And this is where, Samita, the sentence which you were using, that can come in, because it is very important that in this session, the family members are present as well. And you explain to them that how important this program is, not only for the mother, but for the baby. And then you link the baby's health and well-being with the mother's health and well-being. That if the family wants the baby to born healthy, if the family wants the baby to stay healthy, then they need to do what? They need to focus on mother's health. Because mother's health is linked to baby's health. And the baby requires special care from the time when the baby is in mother's womb and during the first year of life. Because this is the time when the foundations for the future for the baby is being laid. So this is very, very important that you start by talking the importance of this program for the mother, for the baby's health, then link the baby's health to the mother's health and explain that what they need to do for looking after the mother's health. That mother's physical and mental health will determine how the baby will progress, and this intervention will help the mother to feel physically and emotionally well. And don't say to the family that you know everything. You need to acknowledge that they have been raising their children up. They do have lots of experience. They do have lots of knowledge, and you are there to share some new ideas. So throughout this first introduction, you have briefly introduced this intervention. You have explained the importance of this intervention for the baby. You have explained the link between baby's health and mother's health. You have explained that how important mother's health is. And you have explained that you have come with some new ideas to share with them. And you acknowledge all the experience which the family has. Because you really want to take them on board, the whole family. So after you have explained this, you show them on your manual, page number 25, these photographs, page 25, and you explain that this program works on improving 3 areas of mother's well-being: mother's personal health, mother's relationship with people around her, and mother's relationship with the baby. And then you explain that why these 3 areas are important. So the first picture where the mother, is holding a glass of milk, that picture is symbolizing the area of mother's personal health. And why mother's personal health is important? Because it is linked to child's health, and a healthy pregnant mother improves the chances of birth of healthy baby, and healthy mother can provide care for the child. And then the picture on your right hand side, it symbolizes mother's relationship with people around her. And why this area is important? Because it increases support for the mother. It makes her feel more confident to provide quality care to her children. And it allows the mother to seek assistance if she needs. There is the picture on the left hand side, which symbolizes the third area, which is mother's relationship with the baby. And you explain to the mother and the family that why this relationship is important. Because during pregnancy, it improves the fetus development and growth. After the baby is born, it improves the mother's emotional and physical well-being. And it has a positive impact on mother's bonding with the baby, this impact continues throughout his or her adulthood. Sometimes you show the picture, you explain that what this picture symbolizes, and then you ask the mother and the family that why do they think mother's personal health is important. So in that way, you are able to engage them more. And then after they have explained, then you explain to them again by summarizing what they have said and by adding some points if they have missed. So it is always a good strategy to first ask them, listen to them, and then summarize and add more. So after you have done that, if you move on to the next page, which is page 26, you can see two pictures here. So in these two pictures, first again, you ask, if it would have been me, I would have asked that what they can see the picture, which is on their left-hand side, which is picture A, and let them explain. And then you talk about picture B. So in this picture, we are talking about the problems or challenges which the mother is experiencing and how those challenges or problems is making her feel. So she is feeling overburdened by these problems. She is obviously upset. Whereas in picture B, something has helped her to manage her problems. So if you can see the size of the problems, which is being symbolized by this Guthrie sack, remains the same, but she has learned how to manage them. So Thinking Healthy program actually helps the mother to manage her problems. You can't be using the word overcome her problems because sometimes the problems are of such nature that they cannot be overcome. But Thinking Healthy program helps you to manage them. Is that clear? So we should not be making any false promises. This program will not make all your problems disappear. Nobody has got a magic wand to make all the problems which mothers are experiencing, but they will learn the ways to manage them. Clear? Then we move to task number 4. And we should not be using the jargon terms like cognitive behavior therapy, which is mentioned in the manual. Rather, we will be discussing with them how our thoughts and our feelings and our behavior are linked. You can again ask them that if someone is not feeling very well, if someone is feeling a bit sad or stressed, what happens then? How do they think? Let them answer, let them come up with some replies. So if someone is feeling angry, you can ask them that if you are feeling angry, what are you thinking which makes you feel angry? If you are happy, what makes you think that is making you feel happy? So that they can start talking about the thoughts. Then there is this table which is given on page 27, which we have also discussed previously. You explain to the mothers, and then it depends upon how in detail you want to go. So if there is a mother who is not very literate or who is not very informed, just give some basic examples. That sometimes mothers, when they are depressed, they can think that, oh, nobody cares about me, nobody loves me, I'm not a good mother. So these are all unhealthy thoughts. So you are trying to explain to them step 1. Then you explain to them that sometimes mothers, when they are in a difficult situation, when their life circumstances are not very helpful, then they can experience these thoughts. And then you explain that it is good if these thoughts are replaced. You can also keep on mentioning behavior as well, which I do, that it's good that if they change their thoughts or their behavior, that is going to help them. So through this program, we will help the mothers to identify any unhealthy thoughts they are experiencing, any unhealthy behavior they are experiencing. Then we help them to change their unhealthy thoughts and their unhealthy behavior. And then we set some practice tasks so that you can practice thinking and acting healthy. So you use very, very common words, no jargon words. Use very simple examples which the mothers can understand. And you are not talking about that mother. You are talking in generally when you are explaining these 3 steps in session number 1. You are not saying that you are experiencing unhealthy thoughts, you need to change. You are just saying that mothers, they do sometimes experience these unhealthy thoughts when they are stressed. And then if they will change their unhealthy thoughts or their unhealthy behavior, they can start feeling better. And then sometimes if they are actively doing they set some tasks for themselves, that helps them to keep on practicing thinking and acting healthy. So you say that in this program, this is what we do. Any question? Okay. So after you have explained all this to the mother, then you stop here and you ask them that, do they want to take part in this program? So now this information which you have given so far is very important. Either you have been able to sell this program to the mothers, or you have not been able to do that. So most probably, if they are not impressed by you or by this program, they will say, no, thank you. If you have used the word depression or things like that, they will say, no, thank you. Most probably, if they are sitting with the mother-in-law or with they might say that, oh no, we don't experience these thoughts. Then you can focus that on the behavior, that sometimes we can experience behaviors, or we have got some more information which you might find helpful. So would you like to try few sessions before you say no? So once they have agreed, then you set ground rules with them, which is on page 29. So it is very important for them to actively participate. For any type of therapy work to actually have the effect, the client, the patient needs to be actively participate. So it's not that they are just sitting quietly listening to the session and that's it. No, they need to be actively participate in it. Okay, sorry. Yes, they need to be actively participate in the program if they want it to be successful, and they wanting to be the support of the family members. So for example, if they have set some tasks, it's important if the family member are supporting them to achieve those tasks. Then being on time is very important. So if they have agreed on some time, then you need to be there on time and they should be present there as well. Many times it happens when the community health worker goes to the mother's house, they keep on knocking and the mother either is not at home or maybe she's so busy that she doesn't want to open the door. Then there are some practice tasks which you can either call homework or practice tasks or between session work, whatever people are more familiar with. They should be told that there are some tasks, but these tasks is not that they can be part of their day-to-day routine. It's not that they have to set extra time for it. They can be part of their normal day-to-day functioning. For example, eating healthy, having some rest, interacting with the baby. And the rule number 4 is that if the mother is not feeling well, or if she is experiencing some problem, then she needs to be telling the community health worker. Are the ground rules clear? Anything anyone wants to add? So maybe you will feel that in your setting you need to add more ground rules, then please feel free to do so. Then you explain the health charts to the mother. You said that you need to be give them the health calendar, which you have photocopied and binded. So give it to them and explain that this is the health calendar, and this health calendar has the pictures in it. So whatever we will be discussing during the session, this can be a reminder for you. And then there is health chart as well, in which you will be, so whenever they will do that activity, they will put a tick in front of that picture. So this is another important task for session number 1, which is to identify a family member or a friend to assist the mother. So because the mother is depressed, and as we know that in depression, you are lacking in motivation. So somebody in the family member or a friend needs to be there to actually encourage the mother, remind her to do those between session activities. So do you think that in your setting this will work? Do people have family members or friends who could actually provide them with the support?
Yes, sometimes.
Yes, it's subjective, ma'am. For some people, it will work, but it cannot be common for everybody.
So where it is working, it's good. Even if they don't have anyone who is living in the house, if they have a friend who could just give them a call every day and ask them that, oh, have you done your task? How is it feeling? How are you doing? Even that can be a big support. So that person need not to be living in the house. And maybe if it's a husband, whenever he comes back from the office, he just spends some time sitting with the wife discussing about the task. So something, a support for her, which actually encourages her. Then this is the mood chart. Okay, so if you go on any page, this is on all the pages, page 135. So this is the mood chart, and it has 5 facial expressions, starting from someone who is very well to someone who is very bad. So a mother has to think every day how she has been feeling, and then put a tick in front of that facial expression. So when you set this mood chart with the mother, it is very important to discuss that what time she is going to fill that in. So usually it has to be sometime in the evening before going to bed, when she needs to reflect on the day and how she has been feeling. So for example, you don't have to tell me this, but for example, if I ask you to mark one of those facial expressions, how you have been feeling yesterday, which one will you mark? So the mother, you can actually, because sometimes when you explain things, people, they don't understand. So actually you have to sit down with the mother, ask her this question and tell her to put the tick there so that she knows exactly what she has to do. Every day at a fixed time. Fixing the time is very important. Otherwise, the chances of this mother completing her mood chart will become less and less. So for example, if I have put bad in front of the bad mood, no, let's for a change. If I have put in front of a very good, the take, then I need to be thinking that what thoughts am I experiencing which makes me feel very good? Or what was I doing which makes me feel very good? So yesterday I can say that, yesterday I was feeling very good because the weather was good. I went for a walk with my friend. I was thinking that life is good. I've got all the leisures in life. I should be thanking God. So you actually encourage the mother to put the tick. And also if she can write somewhere what she has been thinking or doing, which is making her feel like that. So has anybody put bad or very bad? Has anybody been feeling bad yesterday? No. Neither good nor bad?
Bad. I felt bad because I didn't sleep yesterday. My baby, she's just 1 year old and I'm breastfeeding her. I didn't sleep for the whole night.
Oh no.
Yeah.
So you were feeling bad because your baby was not letting you go to sleep and you were feeding the. Can you remember were you thinking something as well? Was there anything going through your mind?
I felt like, if my mother or somebody is there, I can, make them to look after my baby. I can make them to look after my baby so that I can take a small nap. But I did the same. Actually, today I went to my mother's place and I left the baby there so that today at least I'll get some sleep for 2 or 3 hours.
Definitely. So you were thinking, see, when I asked you what you were thinking, you said I was feeling, but then you explained your thought. So as a Thinking Healthy program trainer, you have to be very specific to use the word think, feel, and behave. So what you were thinking yesterday was that, I am on my own. I haven't got anybody to help me. And that was making you feel bad. And because you have to look after your baby, you have to feed the baby, you couldn't go to sleep. So this mood chart helps the mothers to monitor their mood and also to catch any unhealthy thoughts if they are able to catch them. So it serves us two purposes. First, to monitor our mood, and second, to catch any unhealthy thoughts if we are experiencing them. So is there any way you could have think differently or behave differently? I'm asking you. Hi. Is there any way you could have think differently? Yes.
Think differently? Nothing, because I'm a mother. Only I can look after my baby. I cannot, keep on relying on somebody else to, look after my baby.
That's a good thinking. That's a healthy thinking, that I am a mother and it is my responsibility.
That was my choice, because nobody else told me that you should get pregnant and you should give us a baby. It was my own decision, so I'm the sole responsible for my baby's activities. So I
That's
cannot.
an excellent shift of thought. Or you could have said that, yes, I can't sleep now, but maybe once the baby will be asleep, then I can go to sleep.
Yes.
Or you can have asked. Could you have asked someone for help at that time?
Nobody was there actually. Only me and my baby. My husband is out of station, so I cannot, get support from him whenever I need. So my mother-in-law, they are not with me. So yeah. Only one way is that I can go to my mother's house and I can leave the baby there. I can get some, free time or extra time to sleep.
I like your healthy behavior. Go to your mother, leave the baby there.
I have a choice, no?
Good example.
Yes.
That's great. So thank you so much for sharing your experience. Thanks a lot. So now you have explained to them the mood chart. So that is how you are going to finish your session 1. And after that, you will leave their home. Please advise your community workers not to spend more than 1 hour at the mother's home. We have examples where they, after the session finished, they continue sitting and chatting with them. We have examples where they go when it's lunch time or tea time so that the family can offer them lunch and tea. That's not a good practice. So we have to be making sure that they go when the mother is free, just stay there at the most 1 hour and leave them. Because in our cultural traditions, again, when people come, they offer you offer them tea, lunch, whatever. But then the thing is that sometimes when mothers, they don't have anything to offer to them, they become reluctant to receive the sessions. They don't open the door for them. So please tell the community workers that they are not supposed to be eating or drinking when they go there. Their purpose is to deliver the session. Thank them if they offer anything, just deliver the session and come back. Now my question to you is that do you want to do the role play for session 0? Or shall we move on to session 1?
I think we can move to the next for session 1. Does anybody here want to do a role play?
If everything is clear, then we will move on.
Yeah.
I will do just 5 minutes role play of this. Okay. So, who would like to do this role play with me? Anyone, please? Anyone different so that...
Subhashri? Any of the Subhashris?
Okay. That's excellent.
Sure. We have 2 Subhashris today.
Yes, which one? The accounting Subhashri or the engineer Subhashri?
Accounting Subhashri. Accounting Subhashri here.
Okay. Hi.
Hi.
So I have explained to you what Thinking Healthy program is, and I have explained to you 3 areas. Now I'm going to show you this picture. So Subhashri, can you see this picture here?
Right.
These are 2 pictures. Let's focus picture on the left hand side.
Okay.
Can you explain to me how is the mother feeling in this picture?
She feel more depressed and left alone with no help.
Okay.
No support.
Mm.
Okay, she doesn't have anybody to lean on.
Okay.
All that she could see is only the problem that she in front of her eyes.
Okay. Thank you so much, Subhashri, for explaining it so well. So what you can see in this picture is a mother who is looking depressed and she's feeling lonely. She feels as if there is nobody to support her.
Yes.
And Subhashri, she's sitting on a seesaw, and what you can see on the other side?
The other side is there is some support, at least.
No, sorry. On the same on this picture on the left hand side,
right?
What is the thing on the other side of the seesaw?
You mean to say that the image which is there on the left hand side, right?
Yes.
See, you are asking about the baggage, right?
Yes, baggage. Yes, excellent.
See, the baggage is full of not the problems. The baggage is full of the emotions that she has, which she is not able to let out. See, normally the mothers, it is not the thing which is bothering them is not the problem. The thing which is bothering them is they are left out with. She's alone and she's not able to share anything with anybody. So that is the only thing which can bother them. So that's how I feel.
So Bashri, that's very interesting. So what you can see is on the other side of the seesaw is this sack which is filled up with all the unhealthy emotions which the mother is experiencing.
Right.
And there are lots and lots of unhealthy emotions that she's experiencing, and that's why they are very heavy.
Right.
And the weight is too much.
Right.
So that's interesting. And these unhealthy emotions or unhelpful feelings, they have come through the problems which the mother is experiencing. So could you tell me what sort of a problem she could have been experiencing?
Because she's not able to share anything with anyone.
So she has no one to support her, and there is no trustworthy person.
Yes. See, and she's getting irritated by the situation that she is in. That could be a financial stress, or that could be a mental stress, or that could be lack of family support to her, or the reasons that we were pointing out earlier. Yeah.
Unhelpful emotions which she is experiencing, and usually when I show it to mothers, they also talk about the problems which women experience. So, for example, this woman might be experience the problem of poverty. She might be experience the problem of illnesses in her family, problems of domestic abuse.
Also, her own problems will come out, right? While asking these questions, her own self problems, she might kind of say it out aloud.
Yes. So I wanted to actually discuss with the family at this task that what sort of a problems women can experience. And I asked open-ended question to Subharsi, and instead of problems, she could perceive in this bundle all the unhelpful emotions which the mother is having.
Right.
So that was also correct, because this is a picture and picture can be interrupted in any way. But I would like to bring the focus of the family and the mother to the problems which people can experience. So I listened to what Subharsi said and I acknowledged, but then I gradually moved towards the problem which women can experience. So then I started talking about the problems. So then I will say that the mothers which I work with in our community, they are experiencing lots of problems. They could have problem of poverty, illnesses, lack of support, domestic abuse, and all these problems, they can make the mother feel really upset, really stressed, like this mother is feeling. So now let's talk about what's happening in the second picture, which is on our right hand side. How is the mother looking in this picture now?
Of course, yes, but not like the first one. Now, somewhere that she can lean on, and she now, of course, that problem cannot be solved, but now she thinks that she can handle certain things. She's finding a way how to, how to handle the problems, or how to handle the emotions, how to direct the emotions in the
Thank you
right
very much, Subharsi. You have explained it so well that now she has got something to lean on. And now that the problems are the same, but she has learned to manage them. Now, as you can see, the seesaw is more balanced because she has got something. And this is our Thinking Healthy program, because the Thinking Healthy program is going to teach you those techniques which can help you to manage your problems. So that is how I will explain this task 3. Sometimes when you ask the questions first to the mothers can take the question, they can answer in any way which they would like to answer, like how Subharsi does. But then you have to direct it towards what that actually the picture actually is intended to convey to you.
Right.
So you can't stop them or say that, no, you are telling the wrong. This is actually the sack of problems. This is not the sack of feelings. But if Subharsi has perceived it like this, she has every right to do so. And she has explained it very beautifully. Even that was making a lot of sense. But then talking about practical is more tangible sort of things, and you can also give examples. Excellent. Okay. Shall we move on? Any question? Good. So now, after you have done the session 0, which is the introductory session, hopefully the mother has got good idea of what this program is about, who will be visiting her, for how long they will be visiting her, what she is supposed to be doing, those 4 ground rules: active participation and being on time, doing your homework. So then you explain that after you finish the session, it's always good to inform the mother what you are going to do next time when you will come. So you will say that I will visit you again the following week and we will talk about your personal health, because we have discussed that how important your personal health is for the baby and for your own self. You need to be looking after yourself, and we will be discussing how best you can look after yourself. You will explain to them that there are 5 modules. We will be starting our module 1, session 1. So whenever you go to deliver the next session, first you briefly review the previous session. So you explain to them the key points of the previous session. So you can also ask the mother here at this stage that, oh, do you remember what we talked about last time? What are the 3 areas of Thinking Healthy program? But these questions are more to engage them, not to test them. Please remember this. Because sometimes the mothers can feel embarrassed if they don't remember the answer. So our purpose is not to test them. Our purpose is to engage them in the conversation. So you briefly review the previous session, and then you always review the homework which you have given last time. So here in this case, our homework was the mood chart. So we asked the mothers that did you manage to do the mood chart? Did you manage to put the tick? Now there are 50-50 chances. Some of the mothers, in their mood chart, you see 1 or 2 ticks. Sometimes if you are lucky, you will see 4 or 5 ticks. Sometimes you see 0 ticks. And they always have a list of excuses why they haven't done it. So either they are too busy, or they are unwell, or they have guests coming, or they don't remember it, or the health calendar was torn by the child, they can't find the pencil, so they will have a whole list of. So you say that, okay, fine, you couldn't do it this time, but I hope that you will do it next time, because this is really helpful. It will help you to monitor your mood. It will help you to catch any unhealthy thoughts you are experiencing. So you explain to them again the importance of the chart. So you should not be saying that, oh, you should have done it. Why you haven't done it? That is very bad. I am very disappointed. Because when you are saying these sentences, that is going to make the mother feel guilty. They are depressed. They are already guilty. Our role is not to make them more guilty. Our role is to make them feel better. And there are so many people in their lives who are already telling them that you should do that, you should do that. We don't want another person to be going and telling them what they should be doing. Okay. And then again, as a practice, you ask them that, okay, do you remember how you were feeling yesterday? And they might be able to tell you. Then you give the pencil to them and tell them to put the tick here. Sometimes the reason why mothers have not put any ticks is because they have not understood what you have said. And then you ask them that, okay, your mood was bad yesterday. Do you remember what you were thinking? What was happening yesterday which makes your mood bad? So you talk about what was happening yesterday. And when they are talking, please, at this stage, you are not giving any advice, not giving any suggestions. You are only listening to them with empathy. So, and if the mother has put some ticks there, so you pick any tick, maybe when her mood was very bad, and you say to her that here you have put very bad. Could you tell me what was happening that day? Why you were feeling very bad? And then maybe she will explain to you what was happening. And then you ask her that, do you remember what you were thinking that day? So I would like to do the role play of this mood chart. So when you will be actually delivering the 5-day training, what will happen then is that first you will demonstrate it, and then you will make their pairs and you will encourage them to do the role plays. And then after they do the role plays, you give them feedback. So here it's only me doing the role plays with you guys, but you have to be doing these role plays among yourselves as well. So now who is going to do the role play of mood chart, please? Anyone who is feeling sleepy, they can do the mood chart role play. Smita, you decide who is going to do the role play if nobody is coming forward.
I'm just picking from the people whose cameras are on. So we have Subhashri from Ekam, we have Maria, who have not participated.
Even if somebody have not their cameras on, they can also do it. That's no problem.
Anybody? Maria, Subhashri, Ekam.
Yeah, I'll do it.
Thank you, Harita.
Okay, Harita. So, Harita, this is my second visit to your house. This is session number 1, which is on your personal health. And I'm going to do the role play now. So, Harita, do you remember last time when I came, I gave you the mood chart?
Yes, I do remember.
Okay, excellent. Can I see it, please? Oh, good. So I can see, Harita, that you have put ticks on 2 days, Monday and Wednesday, and then you have not been able to put ticks on rest of the days.
Yeah.
Harita, would you like to share with me what stopped you from doing putting ticks on those days?
I was like totally occupied. I didn't sleep for the whole day. The baby was cranky and crying throughout. I didn't even get to use the washroom. So I was like totally held up.
Okay. So you were very, very busy for the rest of the days and you did not find any time to put the ticks. That's all right. But I would just like to tell you, Harita, that it's very important because it helps you to monitor your mood. And we can see how your mood is going up and down on different days in the week. So I will really appreciate it if you could try putting a little bit of time aside before you go to bed, just to think and quickly put the tick how you have been feeling that day. So I would really appreciate it if you could do slightly more times for the next time when I will come.
The challenges I experience a range of moods throughout the day. It's not just one single mood. So I don't know what to take.
Okay. So that is a good question which you have asked. So sometimes what we can do is that we can think of the mood which we are experiencing most of the time during the day. So if we have been feeling sad most of the time, then please put bad or very bad. If you are feeling good most of the time, then put good or very good. So I can see that on Wednesday, you have put very bad. So Harita, could you tell me what was happening that day which was making you feel very bad?
I had visitors come over and the baby was crying and everybody was asking me to show my breast and they were squeezing to see whether I was making milk. And I felt really irritated and violated.
Okay, so that must be very difficult for you. The baby was crying, you have guest visitors and they wanting you to see your breast and touching it. That sounds horrible. That's really bad. So how were you feeling when they were asking you all these things?
I was very angry. I wanted to shout.
Okay. So what were you thinking, Arita, at that time which was making you feel angry?
Don't they have even the common sense to understand that I mean, it's my body. It is my wish to like, whether I would like to expose it to someone else or not. They've been forcing me.
Mm-hmm. So you were thinking that these people, they are very insensitive. They don't have a common sense. And that was making you feel angry. And what were you doing?
I kept quiet. I didn't respond back.
Okay. And when you were quiet, you couldn't say anything. That was making you feel even more angry and upset.
Yes.
Okay. So that must be very difficult for you. So thank you very much, Rita, for sharing this with me. Now let's talk about, because this session is on your personal health, I have got some illustrations to show to you, and then we will discuss about them.
Okay.
So that is the end. So when discussing about the mood chart, you must have noticed that I have not given any advice to Harita that what she should be doing or what she should be saying or thinking. I've just listened to her with empathy. And maybe when we will be talking about the illustrations, maybe this example again come up, or when we are setting tasks, this example will again come up. So I have noted this task, I have acknowledged Harita's emotions, and I have helped her also to understand the link between her thoughts, feelings, and behavior. Any comment on this role play? Okay, good.
So, Dr. Najiya, like in this case, Harita was, very verbal with you. She, she spoke to you. But in some cases, some women might be very, close-lipped. They might be feeling even uncomfortable to share, or sometimes they wouldn't have any thoughts. Their emotions will be very blank. So, or they wouldn't know how to talk to you, explain it to you, or some elders might be at that time, or the husband will be there. So in this case, what to do? Like, is it okay to probe, or just leave it as it is?
You see, you do slightly probe them, but the probing should not be like interrogation and something that is making them feel uncomfortable. So you ask them that what was happening that day. Usually people, they do remember if this is something that has made them feel so bad. But even if they say, oh, sorry, I don't want to share with you, or I don't remember what happened, but I put take care very bad, but I don't remember anything. So then you are left with no choice other than to say that, okay, you have been feeling very bad, but next time it will be really good if you make a little note somewhere that what was happening that day which has made you feel bad and what you were thinking, and then you move on to the next step. So then we moved on to this step again. Now I would like, remember when we did this role play of step 1 and step 2, now I would like 2 people to do this role play with each other, and rest of us will observe. And then we will move on. So remember how when we were doing step 1, we show the pictures, discuss about what is written under the pictures. Picture A is about thoughts, picture B is about behavior, picture C is about consequences. Then we normalize, and then we talk about step 2. So I would like someone to do the role play of step 1 and step 2. Samita?
Can I just call out the names? I'll just be a co-teacher right now. Can we have Maria and either Steffi or Subhashri, Ekam Subhashri, either of you.
And remember, we will be doing these role plays, so everybody's turn will come. Don't think that anybody can escape it.
Yes.
No, it's not.
We have already mentioned before. So again, we'll be having a smaller version with Dr. Srividya. So we will be doing more of these role plays at that time.
Excellent.
So whatever Dr. Najiya did.
Excellent. So when Maria will be doing the role play, I would like everybody to make some points and we will give our feedback.
Okay.
So I'm the mother or the community health worker?
Community
You're the health worker. You're the health worker, na? You're
Okay,
the one
okay,
who's
okay.
going to show the.
Okay, okay. So Josephine, Steffi, your mic is on mute. Can you unmute yourself?
Yeah.
Okay.
Okay.
So Steffi, we just saw the mood chart. Now I'm going to show you some mood charts. Okay. So if you see this, you can see.
Sorry, Maria. Task 3, not the mood chart. The role play.
No, I'm just actually following from you. Like I just said, you have completed the mood chart, and we are going to the.
Sorry. Please, sorry.
So that's a flow, right? No, Dr. Najiya.
Yes,
After the mood chart, it's this, right?
Yes.
Okay. No issues. So if you see in picture here, what do you think of this picture, Steffi?
I have lots of work to do.
Mm-hmm. So you can see a picture of a mother, what she's doing.
She has papers. She has lots of papers, and she's reading. I feel like a mother is reading something which is very important to her.
What do you think she is going? What do you think it's going in her mind while doing that task?
The picture tells me that she is. Her eyes are not fine actually. She is not in a good mood, and she is little worried, little angry. Yes.
Smita, this 1 minute is to me and Steffi, or? Okay, I think it's for her. Okay, next, if you come to the second picture B, what do you think this mother is feeling? What she's doing?
This picture tells me that the mother has a food, but she cannot able to eat. Because she is already packed up with lots and lots of problems going through her mind, emotions. Yes.
And regarding the picture C, what do you think will be the consequences? What's the action of that particular mother?
Could be because she is not finding time for herself, and she's not having a supportive family, and she is like struggling a lot to do things on her own.
Okay, so you were very well mentioned at Steffi. So if you see in picture A, the mother is having lots of work, and due to that in picture B, she's not able to have a healthy diet, and the consequences is she's struggling to balance it. So this is the first set of pictures. Now I'm going to show you the next set of pictures. Dr. Najiya, can you go to the next slide to the healthy? In picture D, what could you see with this? What can you assume from this picture, Steffi?
Okay, picture D tells me that I can have some me time, like I can give my baby to my husband or to my uncle, brother, or to anybody, and I can enjoy with my friend or with my neighbors sometime. Some good time for me.
So you can plan your time. You're saying that you can plan your time by delegating the baby's work to someone.
I can give my work to someone else, and then I can get some more good time to refresh myself, to have a healthy kind of living.
Okay, what do you feel of the picture E, Steffi? What can you assume from picture E?
E tells me that when my baby is sleeping, I can get some time and I can do things that I wanted to do, so that it will be easy for me to complete the work that I wish to complete.
Okay, and for picture F,
and
what do you think the consequences will be?
Yeah, So if I practice things like that, I can be, happily spending time with my baby. I can give more attention to my baby, and my bonding with my baby will be really good. Not tensed or not so hard. It will be very smooth and loving.
Exactly. So, Steffi, you can see the difference, in the both the illustration. In the first illustration, no, the mother was occupied with lots of work. In that case, she was not able to, balance between the work and the personal self, which affected the relationship between her and the baby.
Baby,
And
yes.
if you see the second illustration, you could see the mother did gave some responsibilities to the either to the father or the husband or the father-in-law, and she took her some me time and she focuses on her own self. And in that case, due to her positive behavior, she's having a very healthy relationship with the baby.
Yes.
Can you see the differences?
Yes.
So do you think I don't know how to put this question now. I think I will think Dr. Najiya should help me here. So I need help with the next.
Okay. Thank you very much. Thank you. Thanks a lot, Maria. So we will finish this role play here, and I would like people to give feedback to Maria what she has done good, and is there anything she could have done differently. For the first role play, Maria, very well done to you. It was really good.
Thank you, doctor. I have myself own suggestion. I kind of did. I wasn't, acknowledging the feelings of whatever Steffi said. No, I kind of quickly, I jumped into the next thing. So I was actually at the later stage. I was very conscious about it.
It is a first attempt, and role plays is not easy to do. So come on, team. Feedback to Maria.
I felt overall it was good, as Maria herself told, the transition, between each of the activity, or the transition in making it more vocal from the. It was more of a question and answer, kind of a thing where she was. The link on the story part and transition through that piece was the missing link. Otherwise, she was able to make up that conversation with the mother, and have the mother actively answer to the pictures and the flashcard. The only thing is getting connected to her personally and trying to bring in the flow of transition. And making her, travel through the journey. I think that was the only missing piece. Otherwise, she was able to connect with them, but not completely in terms of the transition and flow.
Thank you very much. Any other feedback?
Thank you, Subhashri.
Dr. Najiya, I had a question actually. So when like how Subhashri pointed about this making a personal rapport, that is probably because she's just done one, out of this thing, she just did one talk now. But in general, is it okay, since we are sitting and witnessing with the mother, going through her thoughts probably with us, is it okay for us to ask her, you seem very tired, like look at her body, make an observation about her body response system, saying that last time when I saw you, there was one smile on your face, but today I'm seeing that it's a little missing. Although you have marked good moods on all days, do you want to talk to me about why there is a shift? Is it intrusive, or is it okay to create a rapport?
It is all right to ask this. If it would have been me, first I would ask that, how are you feeling? Rather than saying that you look bit upset or you look bit happy. First I'll ask the mother. And if the mother has responded back to me, that's good. If the mother will say that I am feeling very bad, then I could have said the last time when I came, you were feeling, you were looking a bit more relaxed than this, or a bit more happy. So has something happened between last week and this week that you are feeling so bad? Or I could make a comment that if I said that how you have been coping with all the housework, and then, so instead of directly saying first time that you look tired, I will first ask her that how you are coping with looking after the house and the child, so that she comes up with the own answers. And then most probably she will give me the answer, and that from that answer I could say that this must be making you feel very tired, and you do look tired as well. So there is no harm
that's a good
in saying that, but first ask that question so that the mother can give you the response. So I am going to give the feedback to Maria. Overall, it was a very good role play. You have covered both the steps. There were some things which were missing. What I would have done is that I would have asked about each picture and then explained the caption underneath it. And then explain to the mother that this is how the mother is thinking. Then move on to the next picture. That this is how she is thinking. Now tell me how she is behaving in this picture. Then read the caption. Then explain that when the mother is thinking like this and behaving like this, let's see the consequences. So I will break each and every picture. So you allowed the mother to talk about all three pictures at one time. We need to help the mother differentiate between the thoughts, feelings, behavior, and the consequences, and the link between all of them. That link part was also missing. You did not explain to her that when the mothers are thinking like this, they feel like this, they behave like this, and this is the consequences. Then after that, you are supposed to normalize it. Remember when we said that mothers, they do feel like this. And then another thing, Maria, which you missed is that you did not ask that is she experiencing any thoughts similar to this, or is she having the behavior similar to this? So then the mother is not being given the opportunity to talk about her thoughts and her behavior.
Actually, I got stuck there. So while I was explaining, the mother was telling about her behavior rather than my mind was fixed in explaining these steps. And when the mother herself started to tell about her experiences with the picture, so I kind of got confused in that place.
No, but you have done it so well, considering that this is the first time which you are doing it. And then
just
again,
one small clarification. Just you're saying you have to show the first picture and ask the mother what she's feeling it. Then later on, have to go and read the caption and explain to the mother what she's feeling it. Am I right? Am I getting
it
you
depends
right?
upon the mother you are working with. Some of the mothers, they are very good. They can explain the picture. If they can't, you have got the caption underneath.
Okay.
So you can be doing it in any form you want. Either you just tell yourself or first encourage the mother to talk about it. Okay. So now I will do the role play. If you open page number 136 on your reference manual. Now you will observe all the steps which I have doing it, because the more structured we will make it, the more easier it will be for the community health workers to follow it. Now, any one of you can become a mother, and you can become as difficult mother as you want. A mother who doesn't want to talk, who doesn't want to share, who is unhappy with me. So any type of mother. So who is going to be a mother who is not?
I'll do the role.
Oh, let's see. So now we have done the mood chart, and now we are on task 3. And can I have you opened page number 136? Can you see the pictures there?
1 minute, just give me a minute.
If you want, I can open page 136 so that everybody.
Session 1.1, 1.1, right?
Session
Yes.
1.1, preparing for the babies. I've opened.
Has everybody got the pictures in front of? Okay. So I am going to show you some pictures and we will talk about it.
Okay.
So can you see picture A?
Yes.
What can you see in picture A?
A dull face.
A dull face.
A mother is, looking so sad.
So this is a mother who is feeling very sad. Her face is very dull. And it seems as if she's thinking something. Can you tell me what she might be thinking?
She might be thinking about her personal problems that she is going through right now.
Okay. So she might be thinking of all the problems which she is experiencing.
Yes.
So what it says underneath this picture is that due to my circumstances, there is nothing I can do to improve my health. So what this mother is thinking, that my circumstances are so bad that I can't do anything to improve my health. So for somebody to be thinking like this, they obviously will be feeling sad and upset.
Yes.
So let's see what she is doing. So in picture B, can you tell me what she is doing?
She is simply sitting and, she is keep on worrying.
Yes. So in picture B, she is not making any efforts to improve her health. Because what she is thinking is that she can do nothing to improve her health. So when you think like this, you feel upset, you feel sad, and then you don't do anything, you don't make any efforts. So when you are not making any efforts to improve your health, what is the consequences? What is happening in picture C?
The baby is getting affected, and so the mother also.
Mm-hmm. So there is a greater probability of mother and infant ill health. They will become more unwell if you will not make any efforts to improve your health.
Yes.
So have you understood the link between her thoughts, how she is behaving, and what are the consequences? So many mothers, when they are in a difficult situation, when they are stressed, they do experience these type of thoughts. And then they stop making any efforts to improve their well-being. And as a result, what happens is that they become more unwell. So do you experience any similar sort of thoughts, or are you engaging in any similar sort of behavior?
Yes.
Okay. Would you like to share with me?
Just give me a minute. I missed that page. Let me come back to that.
Page 136.
Yes. Yes, we can go.
Okay. So can you share with me what thoughts goes through your mind?
Actually, I have a problem like after, I saw these pictures and you explained me her problem. I can relate my problem with this picture.
Okay. Mm-hmm.
Yes.
Mm-hmm.
So, I'm not finding, though I have time, I feel like because I'm not, getting proper sleep, and my baby is, always crying for milk, and, I give more time for my baby. I feel like I don't have enough time to take good food, to do some exercises, because I'm not, taking care of my health. I'm only looking after my baby's health, and I forgot to, even take a little time to do some warm-up exercises so that I can, keep myself healthy, or a good strength will come through the exercises. So I failed to do it because I kept, focusing on my problems rather than focusing the route to, get seek help.
So could you tell me, if you continue ignoring your health, what can happen?
Already I'm, undergoing few health issues, migraine, severe headache. Yeah, I'm taking a lot of pills to overcome
So what you
migraine.
have, okay, so sorry. So what you have explained to me is that currently you are not finding any time for yourself.
Yes.
You are preoccupied with your problems, you have to look after the baby all the time, and you are ignoring your health. And as a result, what is happening is that you are experiencing health problems now. You are having migraines.
Yes.
So just like women in this picture, who is not looking after herself, who is not making any efforts, and there is more chances that she become unwell, you are also not looking after yourself. And what is happening, that you have started to having these migraines. Now I'm going to, sorry.
Can I say, add something? Yeah.
Yeah.
And when I get migraine, immediately, I'll start showing faces to my baby, because I'm not getting proper sleep, and when I get migraine, I cannot spend quality time with my baby. I'll keep shouting at the baby, and I'll be totally depressed.
And how do you feel when you shout at the baby, when you can't give the baby quality time?
Actually, when the baby is ignored, my baby, when I see my baby's face, I'm not happy, because whenever I get some health issues due to my problem, my baby is also getting suffered. She's crying. She doesn't know what to do, because she's a infant. She's a little newly born child. Okay, she cannot do anything on my problem. But because of my issues, I'm also putting my baby into trouble.
So this is not really good, because this is affecting your baby as well, which means that something needs to be done about it, so that your health improves. So I am going to now talk about another set of pictures. We will discuss what this mother is thinking and behaving, and what could be the consequences. And then we will discuss about the problems which you are experiencing. So if you look at the second set of pictures, what do you see in picture D?
A mother is taking healthy food like fruits, vegetables. Yeah.
So this is the mother. And how is she feeling?
She's so happy. She is very clear, and her face is so bright. She's not.
This mother is now happy. She has got a fruit in her hand. And you know what she is thinking now? What she's thinking now is that I can do something to improve my well-being, whatever the circumstances is. Remember, in picture A, she was thinking that I can't do anything. So when she was thinking like this, she was not doing anything, and she was feeling very sad. In this picture, she's thinking that I can do something to improve my health, and she's feeling happy. And what is happening in picture E?
Mother is talking to someone. She's getting some ideas from her mother.
Excellent. So here she's talking to someone, because she knows that if she will be able to make some efforts. So she's talking about health to someone. And what are the consequences then? In picture F,
when she is happy, her baby is happy, and the entire family is happy.
Excellent. So when she has started to make some efforts, the consequences is that the family is healthier and happier.
Yes.
So you have also told me that because of all the problems, you are not making any efforts.
Yes.
And as a result of which, your health is getting affected.
Yes.
So just have you seen in this picture that the mother, she has changed her thoughts. She has changed her behavior. And as a result, the family is happy.
Happy, yes.
So is there any way you can start doing things differently? Is there anything which you can do differently?
Yes, I can do. I can do simple, exercise, and I can start eating healthy food. Take
That's
lots
really
of
good. So now we will talk about step 3, which is about the things which you can do to improve your health. So thank you very much, and I will stop the role play here. Okay, any comments? No comment. Okay. So have you understood all the steps I have taken? Is there anything I could have do differently?
I have a small doubt.
Sorry, yes, please.
When Steffi was mentioning about her migraines and her not being able to take care of the baby, there was a statement that was made. This is not really good. So I see, according to my perception, I can kind of get withdrawn by having a statement like that. Is it just me who's feeling like that, or does everyone agree to it?
No, actually, when I said it's not really good, it doesn't mean that it's not really good for her that she is going through so much. Okay. That is what I was going to apply. I was not applying that why she's having these migraines and she should not have these migraines. Okay. What I was implying is that it must be very hard for her. It's not good for her that she's going through these migraines.
Okay. I mean, the sentence was...
Yes. But thank you. It means that you are listening very well. Good girl. Any other feedback?
It was really nice, doctor. Actually, like how a communication should be initiated and how conscious we should be in the communication is something like which we are like learning too.
And another thing, I don't know whether you guys have noticed or not, in step 1 and 2, I have not given any suggestions or any advice.
Exactly.
Right.
All I'm doing is just helping the mother to understand the link and encouraging her to give examples from her own life. All the suggestions, everything will come in step 3. So please, if anybody is dying to give any suggestions or advice, please hold yourself until step 3.
Right.
All the mood charts, just empathetic listening, all the step 1 and 2, helping to understand the link. Step 1 is understanding the link. Step 2 is how that link can be, how we can break that link. And then step 3 is you are allowed to give suggestions finally. But even then, ask the mother first. Maybe she comes up with her own options.
Right.
Sometimes we think that this is best for the other person, but maybe it's not the best because the person knows what is best for her, not us. We think that we are expert, we are specialist, we know everything. This is wrong. The mother is the expert of her own problems, of her own issues. She understands more than anyone else in the world, and she is the one who can come up with the best options. And if she will come up with her own options, there are more chances that she will implement those options in her life. If we will say, you should do this, there are less chances that she will implement it. So, as an expert, the first thing which we have to do when we deliver this intervention is stop thinking that we know the best. We don't. Just go there as a very humble person who knows some skills, who has some knowledge, but it doesn't make you better than the person you are delivering this intervention. This is the dilemma in our countries, both Pakistan and India. As long as somebody has got some position of authority, they think that they are the best and everybody who's underneath them is inferior to them. That is wrong. You will not be able... Sorry, my last sentence. You will not be able to touch the heart of the other person if you will go with this attitude. Yes, Mehta.
Dr. Najiya, I have actually 2 comments. One was that like you rightly said, you were being very patient from the start and you were literally hand-holding Steffi with her responses. You were actually giving a lot of prompts and what can I say, a leash for her to express her feelings. But in a setting where where probably the time they spend, the facilitators may spend with every mother would be just not probably just 10 minutes, especially if they're observing that the mother is feeling or looking a little depressed. That's why I asked a question earlier on about the body, observing the body. At that time, I agree with you. We do not speed the process. We do not, say that, say more or like that. You shouldn't do that. But how do we tackle that? That is one question I had. And the second question I had was, in this interaction with Steffi, you had, like how Harita has mentioned, there were some points that you said which are very normal for a person outside India to relate to and answer. But for a person who's sitting in India, and for them, when you keep asking about, like, even the setting in RS hospital that we're doing, what we observe is that they're very vocal in a very raw way. They don't talk. I think Subhashri will agree with what I'm trying to say here. They talk, their verbal IQ is very different from what all the facilitators here are bringing. And they're very loud. So how do we counter these 2 points is my question. If it's way out and you're going to address it tomorrow, I will wait. But these are just my observations from all the roles.
So, Smita, your answer to question number 1 is because there is a time which is designated to deliver this intervention, which is from 45 minutes to 1 hour. And these 3 steps of Thinking Healthy program, task number 3 is the main chunk. So spending half an hour on these steps is the time which is required. So you can't be fast speeding these things.
Okay.
The answer to your question number 2 is that's why I asked Steffi to be a difficult mother, but she didn't become a difficult mother. Most of the time when you ask the question in picture A that what is this mother thinking, they will respond by saying, how do we know what she's thinking? So this is one of the common response, but never mind. That's why we have the captions written underneath it. So then you say, okay, you don't know, but let's see what it says here. And then you read the caption. So one of you can do the role play with me when you can become a very, very difficult mother and see how I handle it.
Dr. Najiya, so I also have a doubt, like as in continuation to what Smita just answered, because ACOM has been working in the spectrum of maternal childhood over the last 12 years, and we've been working very closely with UNICEF for last 8 years in multiple interventions. And even during COVID, we had chance of doing a follow-up of about 10,000 high-risk mothers over phone, because during COVID, we were all locked up and we're not able to reach them in person since all the schools are closed where they usually come for a checkup. So when we were also trying to intervene over a phone with a mother, the difficulty was she had as a just born baby, and and when we had put the tool, which is an intensive tool by itself, because it's about like a 30 questionnaire and easily would need 30 minutes to go through all of them, because they're all interlinked, as you're saying. I can't skip one over the other, and I will identify what she's undergoing. And we were trying to give her psychosocial counseling, lactation support through the answers we get, through the discussions we have with them. But you did a very similar project in Pakistan, in this Thinking Healthy manual, where you had this intervention face on face with a mother. How is this receptiveness of such programs when you go into the community? Because we've also seen states like Bihar in India is a very tough state, and people were trying to do various interventions, and people see even the local community person getting basic information from them itself is very difficult. When you try to intervene a little personal, you're here to support them, but you end up getting a little personal with them to help her out. So how was that reflection? Just that, no, as Smita said, the population that we would be catering to is a little not very literate, very loud, verbally, and very difficult to convince them or make them understand that it's for their good. So how do you
our teams, when they go in the community, they exactly face similar sort of challenges which you have discussed. But then some of the techniques which we use is highlighting the importance of this program for the baby child, because whenever it's the child involved, then the families, they become more receptive of the programs. Second is the family involvement. The more you will involve the whole family, the more chances it is for you to continue going in the family and delivering the session. The third strategy, what you can use is to not to use any jargon words, stigmatizing word, not say depression, not say mental health, just use simple words. And then how I have been training my supervisee is that there are mothers at different level of intelligence. Some are very intelligent. It has nothing to do with the education. Even people who are very, very educated, they sometimes struggle to understand things. But then you have to adapt every session as per need of the mothers. So if they are really struggling to understand, then you just get 4 or 5 points out of that session and try to just make the mother understand that. Simplify things. So they can simplify things as per the person's understanding and comprehension. Also, if you feel that the mother cannot give you 1 hour, then you have to be then deciding that what are the things you need to focus on and try to deliver the session in half an hour. So it should not be all or none principle. You should simplify your session. You should try to do not rush things, but then see what is more important. So for example, again, coming back to Samita's point, when the mothers, they don't have that much time to discuss, then you simply explain the pictures, read the caption underneath it, try to help the mother to understand the link between the thoughts, the behavior, and the consequences of her unhealthy behavior. Then you move to the next picture, explain the captions again, that now this mother is thinking differently, she's behaving differently, and these are the consequences. Now let's see the health chart, what you can do. So you simplify the session. So these are the things, and that's why in order for you guys to trust that intervention, you need to deliver it and see the impact. The classroom training is not enough for any of the interventions. The first-hand experience of actually delivering it is very important. And it varies from a mother to mother. Some mothers, you need to be using lots of example to explain things. You simplify the words which you are using. For some mothers, you could go to next level where you are more into deeper discussions with them. So it is challenging, and that's why supervision is very important, because your lady health workers will be, community workers will be coming to you. They will be discussing all the problems which you are experiencing, and you can help them how they can address those problems. But we are experiencing, I have told you in the beginning, the Pakistan and India, they are both culturally very, very similar to each other. Religiously, yes, there are differences, but culturally, it's a 90% overlap. So I have a list of all the problems and challenges, and I will share that list with you, and you can see that how those challenges can be managed best.
Sure. Thank you. Thank you, Dr. Najiya. That answers all of my questions.
So the purpose of step 1 is to, after you have explained the step, you normalize, then ask if the mother has had any such thoughts or behavior. And then there are also examples in every session. If you want, you can give more examples. Examples is a very, very, very powerful thing. The more examples you will give, the better it will be for mothers to understand it. Everything which you say, give an example with it. Okay.
Dr. Najiya, I had a reflection. Can I share?
Yes, please.
Yeah. So basically, I feel when we have these, pictures with us, it helps to structure the session a lot. Plus, it's a safe way to project, whatever the feelings are of the women. They're telling it, if you ask them directly, how are you feeling? What are your thoughts and all? So it becomes like a little too direct. So first they project it on the picture, and then, you help them to relate it to their own thoughts, behavior. So it's a little more safe transition to opening up, and it feels a little more okay, and then it's much more and then moving on further. So basically it helps. And I feel otherwise the conversation can go on very unstructured, and then you need to get the women back, and then you may get pulled into some other thoughts. So if there are other issues, they may need to be addressed, but then this helps to structureize the session a lot.
Definitely. You have summarized it very well. That is exactly the main purpose. Yes. So this is the list of things which we need to be doing when role play for steps 1 and 2, not 3. This is encourage the mother to talk about pictures in step 1, and I think I did that. Help the mother to understand the link. Yes. Realize that this is normalization, that when you are helping the mother to realize that it is not uncommon to have such unhealthy thoughts and behavior, then you encourage the mother to talk about her unhealthy thoughts and behavior. You acknowledge how she has been feeling. Then you talk about second set of pictures in step 2. Encourage the mother to understand the link between healthy thoughts, behavior, and consequences. Encourage the mother to identify her own healthy thoughts and behavior. Understand the mother of practicing healthy behavior, and then, the charts will come. So have we understood so far? Any point? So we have, we have 25 minutes left. So next 20 minutes, we will talk about the health charts. And then 5 minutes for you guys to give feedback, and then we will close our today's session. Tomorrow, if you have some time, I would like you to practice these role plays of step 1 and 2 of doing the mood chart. So this is very, very important, so that when we will do our role plays tomorrow, you have already practiced it. Okay, now we move on to step 3. We have got diet chart for session number, for all the sessions for mother's personal health. So we are focusing on the food stuff which is easily available in the household. We are not expecting them to eat things which they can't afford. That will be very insensitive. And that's why it is always good to start by asking that what do they have for their breakfast, lunch, and how many meals they are. Not everybody is having like 6 meals in a day. So usually people have either 3 meals or 2 meals. So it's important if you engage the whole family in it. Explain that the balanced diet does not mean expensive diet. So the diet chart is clear to everyone. So suppose if there is a mother who is saying that she can only afford to eat 2 meals a day. I'm a mother and I'm telling you this, that I can only afford 2 meals a day. For my breakfast, I eat 1 roti, roti, chapati, with onion. And for my main meal, I again eat 1 chapati and some vegetable curry which I make. How can you make my diet more balanced?
Increase the vegetables.
I can't because I only cook this much food and I have 4 children and a husband and I have to feed them first and then whatever is left over I eat with my chapati.
Take fruits.
Fruit are so expensive. I can't afford any food. Even my children.
Can you take fruits once in a week at least?
You know, I have 4 children and my husband, he is a laborer. So we can hardly eat any fruit. I don't remember over the last month we haven't eaten any fruit.
Think of any low-cost seasonal fruits?
No, fruits are very expensive. All I can eat is chapati and I can't even afford to have curry in the morning. It's chapati, some onion, sometimes just chapati with tea.
Talking about the advantages of having a healthy diet so that it improves her health condition and in turn it benefits the well-being of the children and overall family, can motivate her to probably include something in her diet extra.
That's nice.
Yes, it can encourage me, but the thing is, the problem is that I don't have anything. So these are the challenges which our community workers experience. So I would have asked her rather than suggesting her, this is another point. You guys started suggesting me. Nobody asked me that what is available in my house. So the question would have been that, so what sort of a food is available in your house? Then I might have said to you that yes, sometimes there are lentils and sometimes we have hen who give eggs. So maybe there are eggs, but that is not enough for me. So you encourage them to come up with the solutions. Don't give the solutions yourself. Ask her what she can do. Is there anything I can do to improve my diet? What options I have? What do children eat? What do my husband eat? Maybe I'm giving a glass of milk to my husband and I'm not having anything. So, like Harita has said, then maybe at that stage, I would like to realize that drinking some milk is also important for me. So ask me, don't give me suggestions. First ask me, and when I can't come up with any suggestions, then you can suggest something. Good.
So, Dr. Najiya, so in this diet chart, you have given choice of food items. So, are we going to go for each meal, like breakfast, lunch, dinner, nothing? We are just going to make the client is going to give us a list of items she's having in her household, and we are going to make those as her meal. We are going to give a meal plan.
Maria, you have to be very sensitive and at the same time very clever when making these charts. So if I am a poor mother and I'm hardly affording 2 meals a day, you can't be advising me to eat something 5 times a day.
No. My question is, since the resources are very limited and and the options for the mothers are very limited, I just need some clarity how to plan this diet chart. We are having this chart. For example, let's take the breakfast meal itself. So
let you be a mother, okay? And let me be a community worker.
Okay.
So, Maria, you have seen in the pictures, we have explained that how by making some efforts to improve your health, you can feel better, and that's good for you and for your baby. So I'm going to discuss some healthy activities with you that can be helpful. So the first one is the diet chart.
Okay.
Before I discuss that, I would like to ask you that how many meals you are taking each day?
I take 2 meals a day.
So currently you are having 2 meals a day. And what time are you having these meals?
It depends. I might take at 11 o'clock or 1 o'clock. It depends.
Okay. So for you, the first meal of the day, which is the breakfast, you are having it either 11 o'clock or 1 o'clock.
Yes.
So this is suggesting that there is a big gap because you must. What time do you wake up?
I wake up at 8 o'clock.
So you wake up at 8 o'clock, you are pregnant, you have a baby in your womb, and you are not eating anything till 11 o'clock or 1 o'clock. So this
Because
is
I'm not
something.
able to eat because I'm having this morning sickness, and I'm not able to eat. So I'll kind of wait till I'm hungry. So then I'll start to eat. And I have to have other household work. I have to prepare lunch for my elder one, and I have to prepare lunch for my husband. And for my in-laws, I have to prepare meal for my in-laws. So I have lots of work to do. I don't have time to eat also.
So when you wake up in the morning, you have too many responsibilities. You are making food for the rest of the family. You can't eat because you are feeling morning sickness.
Yes.
Can you drink anything when you wake up?
I can drink some water.
Okay. Any other thing which you can drink, like milk, lassi, tea?
No, I'm having a strong aversion towards milk items.
Okay. So can you drink tea when you wake up or not? Just water?
No, I prefer to have just water because it makes my day very bad. I'll be throwing up throughout the day if I have anything milk in the morning as my first meal.
So you can't anything which is made out of milk. Can you eat any fruit?
We can't afford fruit right at the moment. We are not financially very strong.
Okay. So can you eat any vegetable?
Again, it depends on what vegetable is available. Every day we can't afford vegetables, so it's all like, no.
So what is your family eating when they wake up for their breakfast?
We have idli and sambar, dal. Idli and dal.
Okay. So you can have, the family is having dal and idli. And can you eat any of these items in the morning?
Yes, I can.
Which one can you eat?
I can have one idli and little bit of dal.
Okay.
Because we have a very big family, we can't afford idlis for everyone, so I have to have only one idli for myself.
Okay. So you can have one idli and some dal.
Yes.
And what is the earliest time you can eat?
You can have by 11 o'clock is the earliest time for me.
Okay.
Because
so I'm going to put 11 o'clock here, and you are going to eat idli and dal and a glass of water.
Yes.
Okay. Is it possible for you to eat egg?
We can't afford eggs every day.
Is there anything else which you can afford to eat in your breakfast?
I can't think of anything else.
Okay. And I can see that you have this beautiful garden at the back of your house. You have got this space. Is it possible for you or your family members to grow some vegetables? Like tomato, cucumber?
I can try.
Okay. I think that will be really good. Then you can grow your own vegetables and then you can able to eat it.
I will try to do that.
And sometimes the raw vegetables like the carrots, the cucumber, these are very nutritious as well. They are good.
Sure,
so do you think you will be able to do it?
I will try it next time. I will try to grow some tomatoes and cucumbers.
Okay. And do you, because sometimes at the marketplaces, if you go in the evening, the fruits and vegetables are very cheap. Have you ever tried buying anything from there in the evening?
No, I haven't thought about it. Because they're very expensive for me to buy, so I prefer not to buy that. Instead, I can buy some rice and some vegetables for my family.
Your health is very important. You have a baby in your home, and the baby's health is also dependent on your health. So you need to be thinking of what things are there which you can afford. For example, I know these days the corn is very cheap because it's seasonal.
Yes,
So
yes,
I'm
5
just
rupees a
wondering.
corn.
I'm just wondering what sort of things are available. What other things are available at your home?
Can I have peanuts? Because I could see one lady selling peanuts for very low cost. But my
Yes,
family
peanuts
members
is
are
very
telling
good.
me peanuts are not very healthy for the baby. So can I have peanuts instead?
Yes, peanuts are very good. They are full of proteins and good nutrition. So peanuts are very good. So it's very important for you to have things in your diet, a balanced diet, which is helpful for you and for your baby. And you need to be thinking about what other things are available, which are not expensive. Because balanced diet does not mean expensive diet. So you need to be thinking what else is available at your home. What about chickpeas?
Yes, we do have that.
So sometimes having these chickpeas are really good. Red kidney beans are good, and these are all the items which are available. So
Can I have
here,
leftover rice
leftover rice is very good.
in the morning? Can I make it as a porridge and drink?
Yes, yeah. And you can also go and consult the doctor, your local doctor, because if you are feeling a lot of morning sickness, you can go and ask him, and then maybe he can provide you with some medications as well.
Okay.
And if you can't eat anything at one go, you can eat small things at different time intervals. So see here on this chart, there are 5 times written. So maybe you can have something small at one time, then maybe a couple of hours, something small on the other time.
Sure.
So
Sure,
then
I'll
what
try to
I
do
would
that.
have actually done is then asked you and write down different things which you can eat.
Okay.
So even if it's a corn on the cob which you can eat before lunch, even that is enough. So therefore, the community health workers, they need to have a good knowledge as well about what things are available, what is cheap, what isn't cheap. So please, the local knowledge of items which are cheap is because I know in Pakistan, sometimes if you go later at night in the markets around 8 o'clock in the evening, all the vegetable and the fruits, they are very, very cheap because they want to get rid of it. They may not be the best quality, but they are cheap. Likewise, corn on the cob, these chickpeas, they are very cheap as well. Peanuts. So you encourage the mother, and it's not easy. During the COVID period, my supervisees, they are actually crying because the mothers cannot think of anything to eat. They're really struggling. So then it becomes very, very hard. Yes, please.
Yeah. So, Dr. Najiya, when I was going through this conversation, certain things that you recommended, so we do follow, for both ANC and PN mothers. So, ACOM, what we do is in the Anganwadi centers. Anganwadi centers are these schools which caters to 1,000 population, like in a village. Every village has got an Anganwadi center, where the ASHA workers or the the health workers do work, and mothers report there, come for checkup, and so what we have done is focusing on nutrition literacy. That is our core criteria as part of our well-being initiative. So what ACOM has done is we have built up about 8,000 such Nutri gardens across Tamil Nadu, where we harvest seeds of all the seasonally available vegetables, and the produces that are coming from those gardens are put back into the noon meal program for the children's. So they harvest, pluck it, and put it back for making food for these children of contract workers and laymen and other people who live their children in these government preschool, when they go back to work. So that's the only meal they even have at times, because government pays X amount, and they basically make food and provide these children. And the other way that we are also doing currently is whenever we are doing training on nutrition to these mothers, we also teach them on basic organic farming, like certain produces like methi, which is highly nutritious, which does not cost any much. Basically, they can sow the methi seeds, and within 3 days you can harvest a handful of methi and put it back into your kitchen. So we kind of teach them certain things that are less expensive, because as a pregnant woman they have to add greens into their food. So our core is nutrition literacy, but we also keep this hand in hand on setting up Nutri Gardens, and we also provide seeds free of cost for these pregnant mothers for them to put back in their kitchen.
Excellent.
So that way, there's no compromise, and there's no reasoning of I can't do this. I can't expect them to harvest kgs of produce. It's difficult to maintain a kitchen garden or organic garden, but we tell them this is something that you can even put in your balcony, or if you have a very small backyard, this can even grow in a coconut shell, which doesn't require space. Those are certain things that we always try to engage with these mothers, and that's how this is currently gained a lot of momentum among mothers, where we kind of teach them and also give them these seeds and tell them to practice to make
Thank you so much for sharing this. This is such an important information, and that's why those community health workers, they need to have this information to pass on to the mothers, because what happens is that when you are depressed, you sort of stop looking for options. So even though when the options are pretty obvious to everyone, the mother can't see it. So one of our purpose is to encourage her to look for different options and then to decide which option is best and go for it. So that's excellent.
Yeah, and to add to what Subhashri said, so in Anganwadis centers, you also get this dry ration which women can take home. So basically, that's take home ration. And like in my other projects, I've seen that women who don't have anything to eat at their home, they can make savory or sweet upma or shira out of it. And that serves as a breakfast item, because women generally miss out on the breakfast. So that's one thing. Also, other than that, there are a lot of government maternity benefit schemes under which you can access some nutrition support. So there is PDS support which is available. So all these things, if you put together, connect women, link them to these schemes, that also helps. It may not be able to take care of the entire nutrition needs, but then when you convince her and you link her up, so at least that breakfast or that mid-evening snack that she's supposed to have, at least it will take care of all those things for her.
So that's excellent. So they need to be having all this information, and then filling in the diet chart will become relatively easier. So there are the options, and I'm glad to hear that. Then the second chart is about rest and relaxation chart. Again, like I have mentioned, these activities can be changed, adapted according to your own culture, what is best, how they are relaxing now. Sometimes the mother says that, oh, I am so busy that I can't find any time to relax or to sit down. Then you encourage the mother to share with you her schedule, what is happening, morning, afternoon, evening, because it can't be possible that they can't find even half an hour during the day to rest and relax. You explain to them the importance of resting, the importance of relaxing, and then set up some time with the mother when she can actually sit down, do breathing exercise, when she can go for a walk, when she can sit down, when she can listen to the music, so that there are some breaks between her day. So there can be one small break, 10-15 minutes during the morning, one small break during the afternoon, one small break in the evening. And it is very, very important. Then also, it's very important to encourage them to do breathing exercise. Any task which you are doing, it's very important if you first explain that why this task is important. if you will start telling them the task without telling its importance, the chances are that the mother is not going to do it. Explain why it is important for her, why it is important for a baby. For example, the breathing exercise has lots and lots of benefits. You don't have to pay anything. All it needs is 2 to 3 minutes of your time. So just imagine that this is such a simple thing, doesn't require much of your time, doesn't require money, and it has lots of benefits. It lowers your heart rate and blood pressure, it increases your energy level, it decreases muscle tension, and it has mental benefits as well. It reduces anxiety and stress, it improves your sleep, and it makes your mind more focused. So I am going to stop here because we are almost finished with our training day 1. There are some messages on the chat. Okay, yes. Good. It's very important to be sharing all these resources. And Samantha, you know, the organization which did that trial in India, it's called Sangath, SANGATH. Okay. So if you could try to get in touch with them, phone them or whatever, and ask them if they could share their manuals with you. This is called the trial was on Thinking Healthy program, peer delivered.
Yeah, this is where Dr. Vikram Patel's, right?
Yes, yes.
Yes, Sangat. They have that thing called, they call those people SAKHI. They're calling them that when you read the description. I came across that term, but I got Sangat. Sangat is what I contacted, but there was no response.
Excellent.
Dr. Vikram with London School of Hygiene and Tropical Medicine, that organization.
I think he is working there, but this is his organization in India.
Yeah.
Sangat Exclusive works a lot on mental health.
Yes, you're correct.
So they are in the public.
72-page document. I don't know whether you've seen it, Smita. I just push it. I don't know whether it is the same thing. What is health? I don't know whether it's focused exclusively on mothers. It is on depression.
So the trial was on Thinking Healthy program, peer delivered.